Faites l'appel, s'il vous plaît, monsieur le greffier.
Monsieur le connétable de Saint-Hélier. Madame la connétable de Saint-Laurent.
Présente.
Monsieur le connétable de Saint-Brelade. Monsieur le connétable de la Trinité.
Présent.
Monsieur le connétable de Saint-Pierre.
Présent.
Madame le connétable de Saint-Martin.
Présente.
Monsieur le connétable de Saint-Jean.
Présent.
Monsieur le connétable de Saint-Clément. Monsieur le connétable de Grouville.
Présent.
Monsieur le connétable de Saint-Ouen.
Présent.
Monsieur le connétable de Sainte-Marie. Monsieur le connétable de Saint-Sauveur. Monsieur le député Southern. Madame le député Labby.
Présente.
Monsieur le député Tadier.
Présent.
Monsieur le député Luce.
Présent.
Madame le député Doublé. Monsieur le député Morel.
Présent.
Madame le député Lehegara. Monsieur le député Ayer.
Présent.
Monsieur le député Ward.
Présent.
Madame le député Alves.
Présente.
Madame le député Gardner.
Présente.
Monsieur le député Gorse.
Présent.
Monsieur le député Farnham. Madame le député Moore. Monsieur le député Mezek.
Présent.
Monsieur le député Joseph. Monsieur le député Balash.
Présent.
Monsieur le député Coles.
Présent.
Madame le député Poré. Monsieur le député War.
Présent.
Madame le député Miles.
Présente.
Madame le député Scott.
Présente.
Monsieur le député Renouf.
Présent.
Madame le député Curtis. Madame le député Felton.
Présente.
Madame le député Binet.
Présente.
Madame le député Jeune. Madame le député Miller.
Présente.
Madame le député Howe.
Présente.
Monsieur le député Binet.
Présent.
Monsieur le député Ferry.
Présent.
Madame le député Kovac.
Présente.
Monsieur le député Curtis. Madame le député Ward.
Présente.
Madame le député Wilson.
Présente.
Madame le député Stevenson.
Présente.
Monsieur le député Andrews.
Monsieur le doyen.
Notre soit au nom de Dieu qui a fait les cieux et la terre. Amen. Seigneur Dieu, Père éternel et tout-puissant, qui a établi les gouvernements et les puissances de la terre, pour le règlement et pour la conduite du peuple, et qui nous a commandé d'avoir toujours pour but la gloire de ton saint nom. Nous te prions qu'il te plaise de donner à cette assemblée le don de conseil et de prudence, d'unir le cœur et les affections de tous ceux qui la composent, de les conduire tellement toi-même par ton Saint-Esprit que toute l'heure de l'opération est accompagnée de ta bénédiction. Réussisse au bien ce soulagement du peuple qui de plus te commettre à leurs soins. Car nous t'en prions au nom et par les mérites de ton Fils bien-aimé Jésus-Christ, notre Seigneur, qui nous a enseigné de t'invoquer en disant: Notre Père, qui es aux cieux, ton nom soit sanctifié, ton règne vienne, ta volonté soit faite sur la terre comme au ciel. Donne-nous aujourd'hui notre pain quotidien, et nous pardonne nos offenses, comme nous pardonnons à ceux qui nous ont offensés. Et ne nous envoie pas en tentation, mais délivre-nous du mal. Car à toi est le règne, la puissance et la gloire, au siècle des siècles. Amen.
Monsieur le connétable de Saint-Brelade.
Défaut.
Monsieur le connétable de Saint-Clément.
Malade, ça.
Vous jurez que Monsieur le connétable de Saint-Clément est tellement indisposé qu'il ne peut pas assister aux États sans exposer sa santé.
Ça.
Monsieur le connétable de Sainte-Marie.
Présent.
Monsieur le connétable de Saint-Sauveur.
Défaut. Ah, présent. Présent. Sort of.
Monsieur le député Southern.
Présent.
Madame la Deputy Doublé.
Present.
Madame la Deputy Lehegara.
Sir, Deputy Lehegara is currently attending a funeral and is due back around lunchtime. If she could be marked excusez, please.
Excusez.
Monsieur le Deputy Farnham.
Therefore,
Monsieur le Deputy Ozef.
Présent.
Madame la Deputy Jeune.
So Deputy Jeune is making her way back to the island from State's business and should be here later this morning. Should she be marked excusez?
state's business.
Monsieur le Deputy Curtis.
Présent.
Sir, I have a funeral to attend this morning and I wonder if I could be marked FO excusez if I'm not here for the votes.
Yes.
Thank you, sir.
No reason why not. I mean, I don't think, I think the referee reminds me, we don't need to mark you defo excuse. You're here for the roll call. You simply won't be recorded as having exercised a vote. But you've explained, and Hansard now reflects the fact that you'll be at a funeral. Very well. Before we move on with business this morning, Connétable St Martin, do you have any anything you wish to put before the Assembly as a result of the deliberations overnight?
Yes, thank you, sir. And I'd like to thank everybody who responded to the emails overnight. That the vast majority did. So, sir, having consulted with members, this is what I'd like to propose for the arrangement of our time this week. I am not proposing that we return after the vigil service this evening, as a majority of members are against that idea. I would therefore like to propose that we meet until 8 p.m. on both Thursday and Friday, with a short adjournment at 5:30 on each day of 15 minutes. In terms of time limits, I'm not asking you, sir, to rule on whether a shorter time limit than 15 minutes should be implemented. PPC will look at the guidance on time limits in the new year. On the back of this, we can see if improvements can be made. But a number of members have expressed concern about the precedent that would be set if we were to introduce a new hard time limit in this way and at this stage. Nevertheless, I would encourage all members to be mindful of the length of their speeches, something which all members have supported, even if they were not in favour of new time limits. There was insufficient indication regarding early starts, and I'm not therefore making any proposal at this time to change our start time. I will revisit the situation at the end of today, and we may need to see where we are at this time tomorrow and whether any further decisions need to be made. I therefore would like to make the proposal for sitting late on Thursday and Friday evenings. Thank you, sir.
Is that proposition seconded?
Yes, sir.
Yes. Does any member wish to speak on the proposition? The Assembly will start at 9:30 as usual on Thursday and Friday. We'll take the usual hour that we specify for this week for lunch, but then we'll sit until 8 with a break at 5:30. 5:30 for 15 minutes or so, which is obviously essential for members and indeed for the court, for the state staff. Yes.
Sir, I wonder whether or not it would be possible for the GREF to kindly put the clocks so that even though those members who are not limited by speeches can give an indication as to how long they're speaking. It may be, having taken soundings from other responders and proposers, it may be helpful for the clocks to be put in place even though they're not mandatory, just so that they can be shown how long they're speaking, because it's difficult.
Well, if that's physically possible, and I'm not sure it is, it'll be done as soon as it's convenient, Deputy. I will simply add my own words, if I may, to those of the chair of PPC. There's obviously an enormous amount of work to get through in the next few days, and it's not certain that one will be finished even by 8 o'clock on Friday evening unless people exercise self-discipline as to, firstly, whether or not they need to speak, and secondly, whether or not they need to dilate upon the essential points in their speech. I mean, it's sometimes very tempting to indulge oneself in quips and quiddities and all of those kinds of things, but that might not be conducive to moving the debate along at pace. Anyway, I say that for what it is worth, and it's a matter for members, of course. Very well, we continue now with the debate on P97, Amendment number 20. The last person to speak was the Connétable St Brelade. Does any other member wish to speak? Deputy Tom Binet.
Thank you, sir. Firstly, I'd like to thank the Assembly for supporting the direction of travel of the review, which changes the focus of this amendment from a position of uncertainty to one where we will be able to spell out our intentions and hopefully make provision to fund them. I'd also like to thank Deputy Farnham and the project team for all their work on the single site at Overdale, much of which can be reused, particularly in relation to the clinical standards and requirements that will assist us in making rapid progress in the new year. So, having listened to many of the comments made during the debate on Deputy Farnham's proposition P109, I feel it is important to be clear about what is intended of this proposition, particularly in relation to 2023, why this approach is being taken, and the effect that this does, and perhaps more importantly, does not have on previous decisions taken by the Assembly. As far as the intention is concerned, the proposition, if accepted, will allow the Council of Ministers to work with health staff to define the split of clinical services and optimise clinical adjacencies prior to seeking the support of the Assembly for dual or multi-site hospital facilities. It will also enable the drafting of plans required for the purpose, produce a costing for the development, schedule timings for deliverables, and give some indication of the running and staffing costs involved. In other words, it will in part fund the production of a full business case. It will also fund ongoing works at the Lekenove site with additional funds to improve insulation in certain parts of the building and pay for landscaping works, which should a decision be taken to make full use of the site in the longer term. At this point, sir, I'd like to provide assurance to the Constable of St Brard, who during yesterday's sitting very sensibly inquired about the £7 million specified for the purpose in the amendment. I'm pleased to say that of that sum, £5 million forms part of the total amount already committed to the project, and the remaining additional £2 million would be to fund the insulation and landscaping and car park refurbishments mentioned a little earlier. In addition, sir, it will fund the strategic acquisition of the Kensington Place site from Andium Homes, so that it is in the ownership of the Government of Jersey, enabling us to move quickly should the dual site development of hospital facilities prove acceptable. I should mention at this point that this exercise is vital for another reason, and that is to ensure that Andium Homes aren't left for an extended period holding investment in a site that it isn't able to utilise. As for why we're proposing to alter the funding arrangements originally stated in the government plan, this is quite straightforward. As we've seen from the results of the debate relating to Deputy Farnham's proposition, the majority of the Assembly appear to support further work that builds on the findings of the Our Hospital 100-day review. The numbers proposed in the original government plan reflected the ongoing tensions of the previous Our Hospital project. However, we felt it would be disingenuous to simply proceed with the planned works, utilising funds designated for a different purpose. Fortunately, the result of yesterday's debate suggests that this course of action may well be understood and appreciated. So, moving now to the effects this proposition does and does not have on previous decisions taken by the Assembly. I can confirm that it allows for us to do the more essential elements of Deputy Farnham's earlier proposition, but in this instance with a fully focused direction of travel, with an end in mind and within an appropriate timescale. Importantly, and concurrent with this work, it enables the purchase of essential property in a timely manner and sufficient investment in current projects to ensure that they will be fit for purpose in the proposed new scenario. What it does not facilitate is the revocation of any of the decisions made by this or previous assemblies in relation to the physical elements of the Our Hospital project, nor does it invalidate the planning permission granted for the Our Hospital project at Overdale. Sir, there is much work to be done, and whilst we now have a more defined direction of travel, we will certainly keep our options open to ensure we provide the most appropriate and deliverable project possible. I'd also like to make it clear that this amendment includes no funding for activity beyond 2023. The funding it would provide is that which is required to enable the project to progress for the next 12 months. Beyond that, sir, we will need to come back to the Assembly for their approval, not just for funding, but also for the amendment or rescindment of any extant decisions and any major proposal that may become appropriate at some point in the future. So I trust this explanation sets out our intentions in clear, open and honest terms, just as this new Council of Ministers promised to do at the time it took office. On that basis, I ask members to give their wholehearted support to this amendment. Thank you, sir.
Very much, Deputy. Does any other member wish to speak on the amendment? Deputy Felton.
Thank you, sir. I am happy to follow Deputy Binet as he raised a few points that I would like to just discuss as a constituency deputy, because no matter which site we're talking about, aside from the St Brelard sites, all of the St Helier sites fall within my constituency. And within the review and within what we're reading in the government plan amendment, there are still so many questions that need to be asked about the impact of the plans on my constituents, both in terms of the road, in terms of the site acquisition of Kensington Place, and also in terms of the impact on the many healthcare staff that also live in my constituency due to its proximity of the hospital site. I looked at this amendment and I thought to myself, what would encourage me to support it? Now, I am quite a risk-averse person, and I see Deputy Ward nodding and agreeing there. He knows me well. I am a risk-averse person, and the reason I think I would support this would be to mitigate risk if I was concerned that the Treasury Minister could not be trusted to keep a tight rein on the purse strings during this period of uncertainty on how the project will proceed. Because effectively, by not approving this, all that remains in place is the facility for the Treasury Minister to borrow up to the previously agreed amounts. Now, I'm sure many members will agree with me that there's probably no other member in this Assembly that we could trust more to keep a tight rein on purse strings than Deputy Gorst. So for me, that risk is mitigated. But the risks that aren't mitigated are the risks around the questions that I have in relation to my constituency and the effect of the plans on my constituents. So that is why I will not be supporting this amendment, and I would like government to come back to us with standalone propositions with far more detail about the buying of the site at Kensington Place and how that's going to be purchased and what that means, what other risks that entails. Far more detail around what the implications are in relation to traffic and other services for my constituents, and far more detail about what this reduction in budget means about the timeliness of the building of the hospital. Because the way I'm reading this, and I think it was confirmed by Deputy Binet in his speech, is that the funding that is confirmed within this amendment is funding essentially for more preparatory work. Now, I have constituents that work in the hospital that are asking when there's going to be a spade in the ground, and I don't want to be supporting an amendment that may well prevent that if the government finds itself in a position that it can proceed with some form of building before the end of the year. Thank you.
Thank you very much, Deputy. Does any other member wish to speak on the proposition? If no other member wishes to speak, then I close the debate and call upon the Chief Minister to respond.
Thank you, sir, and I thank those members who have spoken, and I can wholeheartedly agree with Deputy Feltham that the Treasury Minister does indeed hold the purse strings tightly and is indeed, and I think as members agreed at the very beginning of this session and this Assembly, that he is most certainly the right person for that particular job. So I do ask that members support this amendment to the government plan because it enables us to bring the development to the full business case stage. It is important that we are able to deliver that level of detail to the Assembly, and it is the right and appropriate way to do it. I do understand some of the concerns that have been raised about Les Quenevets, but why spend twice? The previous government was renowned for spending twice on projects, sometimes even 3 times. And the move of some facilities to Les Quenevets was exactly one of those examples. If you take the Child Development Centre, which had recently been refurbished for the cost of £3 million in 2018, they were proposing to move it to Les Quenevets, which of course is being prepared and an investment made to make that happen. And then it was going to be moved elsewhere to a location that hadn't yet been agreed. That, in my view, was spending thrice, not even twice, and was totally inappropriate and wasteful. So, sir, I would urge members to help us ensure that the monies being spent on the Les Quenevets facility will endure and will serve the healthcare needs of islanders, and particularly those in the West, for the long term. Indeed, it is an example of spending wisely in my book. On the point of the additional money, which has one member raised, increased from that which was proposed under the previous government's plans, that is due to an overspend that was incurred on that project, and unfortunately it's something that we have to withstand. Town deputies mentioned Kensington Place and, of course, and as did others, the contract there. We, of course, do not want to tie the hands of Andium, and it is only right that we pay the fair price for that site so that we can enable them to carry on and deliver better homes for islanders elsewhere, such as at St Saviour's Hospital, where they will be able to develop a fine environment for islanders to enjoy affordable accommodation in pleasant surroundings. There has been much talk, sir, of town cramming and members' concerns about that in previous debates, and I would like to suggest that we should certainly move away from the plans to in my view, create more town cramming, if that is members' views. If that proposed site at Kensington Place were to take place, yes, it's 106 much-needed units of accommodation, but it was a development that was in fact criticised by the planning inspectors when they conducted their inquiry into the Bridging Island plan, and it is not the kind of accommodation that we want to deliver for islanders. We can do better, and I hope that islanders will support us in moving this forward so that we can. Finally, sir, as the Minister for the Infrastructure stated in his speech, we will be coming back to the Assembly as and when appropriate for their further agreement and to enable scrutiny to take the time that they need to scrutinise any further plans as we progress on this project. We will most certainly do that along with the Assembly as at the right time. But, sir, for the moment, I ask members to support this amendment.
So, before we move to the vote, could I raise the defo on the Constable of St Brellard's?
Yes, defo is raised on Constable of St Brelard.
Sir, can I raise the defo on Deputy Farnham?
Yes, indeed. Yes, I'd have to now, well, I can tick the boxes later. Very well. Do you call for the appel, Chief Minister, or?
I do, sir, thank you.
Appel is called for. I invite members to return to their seats, and I ask the greffier to open the voting and members to vote. The vote is on the 20th Amendment to the Government Plan. Members have had the opportunity of casting their votes. Then I ask the greffier to close the voting. The amendment has been adopted. 33 votes pour, 1 abstention and 12 votes contre.
Move the one, please, sir.
The member who abstained, Deputy Scott.
Very well. We now move on to the fourth amendment, the Health Insurance Fund transfers lodged by the Health and Social Security Scrutiny Panel. The main respondent will be the Minister for Health and Social Services. I think, Deputy Southern, you're presenting this, is that correct? Are you accepting the amendment of the...
No, sir, we're not accepting the amendment.
Very well. Then, in which case, I ask the greffier to read amendment number 4.
Page 2, paragraph C. After the words Article 9(2)b of the law, insert the words, except that A, the transfers from the Health Insurance Fund to the Consolidated Fund Revenue and Consolidated Fund Capital should be reduced to 0 for 2023 and 2024. And page 2, paragraph E, after the words of the report, insert the words, except that A, the general reserve head of expenditure shall be reduced by £12,450,000 for the purposes of funding the Jersey Care Model, the Jersey Care Model digital systems and the digital care strategy.
Deputy Southern.
Thank you, sir. And what I have by way of title on my speech today starts with the words promises, promises, promises. Because that, to be frank, is what I think we've been receiving on the end of for the past 10 years. Lots of promises to preserve the HIF, the Health Insurance Fund, and nothing to back it up. It's been spent, spent and spent, not on its original purpose, on primary care. So the prime function of this government plan amendment is to prevent the Social Security Minister, along with the Health Minister, from once more raiding the Health Insurance Fund and using it to fund whatever projects they see fit. And we'll see, as we go along, how those amounts allocated away from primary care and towards other things grows like topsy as we go along. The Health Insurance Fund is supposed to be tightly controlled by the Minister of Social Security to collect social security contributions, that is 1.2% from employers and 0.8% from employees, to meet the primary health care costs of the public. And these effectively are largely pharmaceutical and GP fees. And members will be fully aware that whilst pharmaceutical costs are low, GPs are far from that, but are high. And I say sadly, rather, once again, because this is far from the first time that the Health Insurance Fund has been raided. The very first time, to my knowledge, was back in 2010, when P125 of 2010 redirected funds from the Health Insurance Fund to cover diabetic, dietary and continence products already administrated by HSS. And this was a relatively small amount. But when we come to 2012, I've got a third hand here. Invisible hand that helps me out. Bear with, bear with. The provision of the health, the first of the major raids took place in 2012, when P88 diverted £2 million in 2013, £6 million in both 2014 and 2015, and at the time we were assured that these transfers were only to be used for the primary care services provided by HSS and will be subject to the strict control of the TNR Minister. So not only have we got one layer of safety in there with the Social Security Minister, But if they get generous with funding, then Treasury Resources steps in and says, hey, hang on, what are you using that for? Is that justified? And the answer has been, along the way, yes, it's justified because we say it is. 2020 also saw the start of ramping up of the sums involved. In addition to a £5.3 million loan because of COVID, there was an £11.3 million transfer from the Health Insurance Fund to other costs. And here we have that £11 million broken down. The Jersey care model, £6.6 million. That's no longer in existence. We've relabeled it something else. The Jersey care model, digital, for IT developments, £1.3 million. Digital care, again, £3.4 million. So we've got a chunk of material there that is being used other than what it's designed for, which is primary care. And if we look at what the Primary Care Board says about those changes, it says the following. We understand that a sum in excess of £11 million has already been allocated to health to replace secondary care IT. Note, secondary care IT, not primary care. Again, a diversion wrong. Whilst this capital investment is overdue as a result of decommissioning of previous software with limited capabilities, it does not represent investment in primary care IT, nor does it appear to have any link with the JCM. So the people who are on the receiving end of this fund are complaining, like Billio, that it's not going to the right place. The government plan, they go on, the government plan has no specific proposals on how general practice and wider primary care will be funded, and no specific proposals as to how the Health Insurance Fund will be maintained. Indeed, the PCB, the Primary Care Board, have complained about this in the past. They go on. We have yet to see any proposal in support of the statement that money will follow the patient to allow transfer of care to the community in the longer term. In addition, the need for associated infrastructure and its costs has not been addressed. In the meantime, diverting funds, they say, will inevitably reduce the sustainability of the HIF Health Insurance Fund and its ability to continue to support patient benefits. It should be remembered that the principle of the HIF is to support patient access to primary care services. As such, HCS budgets should not be supplemented by money from the Health Insurance Fund. And that's what the GPs largely have to say about that. If we examine the text attached to the Government Plan 22-25 on page 169, it reads as follows. Following transfers in 2020, transfers up to 11.3 million will be made in 21. And it is intended that a further £33 million of investment in the Jersey Care model and digital will be met from balances held in the Health Insurance Fund. Note that sum. All of a sudden, we've got a massive increase in the amount of money that's going away from primary care into secondary care in one form or another. £33 million in that particular government plan. Overall, the net effect on the health insurance fund is a move from an opening balance of £92 million in 2022 to a closing balance of £48 million in 2025. That's approximately 1 year's funding. It's on a very slippery slope, the funding for primary care. Turning to the most up-to-date government plan, 23 to 26, on page 69, we find the following. During this government plan period, work will continue on redesigning and digitising health and social care. Following transfers in 21 and 22, it is anticipated that a further £22 million will be invested from the Health Insurance Fund between 23 and 24. In addition, the Minister for Social Security commits to a transfer of £13 million for 23. And after all these transfers, the Minister notes that the closing balance of the HIF is just under 2 years' worth of expenditure. The Health Insurance Fund is living on a knife edge. It may well go under at any stage. But where's the report that assesses that? That says, oh no, it's perfectly safe, or hang on, we better be very careful around the HIF fund. It's not there. Promise after promise to do a review of how effective the Health Insurance Fund is has not come to pass. We've ignored it, crossed our fingers, and said, let's hope everything works out in the end. That appears to be what we're doing. Bear with me. These computers, eh? So, according to my calculations, there has been some £60 million or thereabouts redirected from the HIF, from the Health Insurance Fund, towards the JCM and related digital innovation. In order that such spending is subject to proper governance, both ministers have given repeated assurances that the proper safeguards are in place. In the case of the Health Minister, she insists that sustainable funding will be in place before allowing any further withdrawals are made. Sustainable funding will be in place before any further withdrawals. Is that happening? No, it's not. This government plan says withdraw more money from the Health Insurance Fund. The amendment says stop doing that. You're putting the Health Insurance Fund at risk with no great alternative as to how we're going to fund primary care. There's no allowance in there at all. The Social Security Minister has gone further in calling on the actuaries to review current practice. Specifically, they talk about an actuarial review of the Health Insurance Fund is prioritised in 2022 and will include specific analysis of the use of the Health Insurance Fund for the purposes of the Jersey Care model and its related digital strategies. Consideration of the impact of all the withdrawals on the fund since 2020. Actuarial report with details saying, and this is what's happening. The future of the Health Insurance Fund, should withdrawals take place as envisaged by P130 of 2020, as part of the wider review, Sustainable Healthcare, there will be a specific consideration undertaken to repaying the HIF from the Consolidated Fund if no sustainable healthcare funding is operational by 2025. Don't worry about it then. If we haven't sorted it by 2025, we'll repay it back into the HIF fund. How short-sighted can you get? About as short-sighted as these ministers, who have been fobbing us off, and their predecessors fobbing us off. I got a smile. With promises, promises, promises. And just by way, I hope, what have we got here? Yeah. Of summing up, I'll take three statements here from either the Social Security Minister or the Health Minister from 2020 or 2022. The government plan we will be debating in the next few weeks recognises the need for quick action. It brings forward the need to deliver a solution to make sure that health costs are funded sustainably, and it commits to undertake a full review, which will include taking proposals to this Assembly ahead of the 2022 government plan. Are we ahead of the 2022 government plan? We are not. Including proposals brought to this Assembly as to how we should progress. Has it happened? No, it hasn't. We will undertake, again, this is the JCM, we will undertake a full review, which will include taking proposals to the States Assembly ahead of the next government plan to determine an appropriate model for future health funding. That doesn't exist yet. The work has not been done. We're just hitting and hoping. And finally, the 2021 government plan sets out further transfers in 2022 and 24. I, again, will only put these forward after ministers have completed and the planned review of sustainable health funding and brought proposals back to the Assembly during 2023. That's the promises that have never been delivered. We have a health insurance fund now, which we don't quite know what state it's in, but it's not in a very healthy state at all. This amendment says, halt this process until you have the report. The report is due. Not in 22 though, because that's just gone. 23 or middle of next year, perhaps late next year, we'll see the report, in which case we can decide what we're going to do with the health insurance fund. Because we'll have some information, some evidence to base it on. At the moment, we haven't got that. This is a safety first amendment, which I encourage all members to vote for.
Thank you very much, Deputy. Is the amendment seconded?
Yes, sir.
There is an amendment to the amendment, and that is brought by the Council of Ministers. I'll ask the greffier to read the amendment.
1, page 2, part 1. For the words shall be reduced to 0 for 2023 and 2024, substitute the words shall be reduced to £4,178,000 revenue and 0 capital in 2023 and £3,216,000 revenue and 0 capital in 2024. 2, page 2, part 2. For the words the General Reserve head of expenditure shall be reduced by £12,450,000, substitute the words the General Reserve head of expenditure shall be reduced by £7,378,000. And after the words digital care strategy, add a new subparagraph B as follows. B. The head of expenditure for health and community services shall be reduced by £894,000.
Who is proposing the amendment on behalf of the...
I am, sir. Thank you.
Yes, Ms.
Thank you. Sir, I would urge the Assembly to support this amendment to the amendment which is proposed on behalf of the Council of Ministers. The amendment proposed by the Health and Social Security Panel, if unamended, would seek to reduce the funding from the Health Insurance Fund, otherwise known as the HIF, for those projects and programmes that until recently were collectively known as the Jersey Care Model. The panel would seek to reduce HIF funding for these projects to zero and instead propose that funding be sourced from the General Reserve. Members will know from the report supporting our amendment that we as a Council of Ministers acknowledge the panel's concerns about the use of the funds from the HIF for such purposes. But members will also know that I too, as the relevant minister, had concerns regarding the efficacy of the projects being funded by the HIF and recently concluded my own review of the Jersey Care Model. In summary, it was determined that many of the services are actually necessary for the redesign of our health and care service. Therefore, as a council, we are confident that it is appropriate that some funding from the HIF be used for the purposes of redesigning our health and care service. But we do also recognise that funding needs to be found from elsewhere. As such, our amendment proposes to reduce the overall requirement for funding from the Health Insurance Fund and use some funding from the General Reserve to cover any difference. So we are confident as a Council of Ministers that our proposal is a sensible alternative and a middle way to address the panel's amendment. I would like to open the debate to the Chamber and will do my best to address any points raised by members in this debate. Thank you, sir.
Thank you very much, Minister. Is the Council Minister's amendment to the amendment seconded?
Yes, sir.
Much. Deputy Balash.
Sir, thank you. I supported ministers in relation to the hospital, but I am not going to support this government amendment. In fact, I think ministers should be a little ashamed of this attempt to continue the plundering of the Health Insurance Fund when they have acknowledged the validity of the concerns expressed by the panel. The panel wants to draw a halt to it. The government says, in effect, that they know the panel is right, but they want to take just a little bit more. Just over 4 million in 2023 and just over 3 million in 2024. It is like the little boy in the sweet shop, caught with packets of stolen jelly babies in his pockets, but hoping that he will get away with the stolen gobstoppers in his satchel. Members are entitled to expect that the Council of Ministers will be principled in its actions. I fear that on this occasion, that principle is lacking. Their report contains some weasel words about protecting the reserve fund, but the reserve fund should not be protected by robbing Peter to pay Paul. It should not be protected by taking money from another fund, which in truth belongs to the contributors to the HIF. This is not money which ought to be used for the general purposes of the Health Department or the Jersey Care Model. It is money contributed by employers and employees from their wages for a specific purpose. And that purpose is to make it possible for contributors, the public, to be able to afford to go and see a GP when they need to do so. It is about affordable access to a doctor. That was why the health insurance law was enacted in 1967. It's an insurance scheme. You pay your premiums or contributions and you get the benefit of a reduction in the cost of seeing the doctor when you are ill. Originally, medical benefit was intended to cover 50% of the cost of seeing a GP. And of course, there was the health insurance exemptions to enable lower income groups to have free access, now replaced by a comparable provision for those on income support. I know, sir, that the 1967 law has been amended to allow successive governments and assemblies to use the HIF for other purposes, originally for funding different primary care services, and since 2018, effectively for almost any expenditure of the health department. But that last amendment in 2018 was as unprincipled as is the government's current amendment and should be repealed. What have been the consequences of taking money out of the health insurance fund? First, the value of the fund, which underpins the whole insurance scheme, has been severely diminished. The chair of the panel says that 60 million has already been taken. Secondly, the medical benefit, what is deducted from the GP's fee, has not been increased for the last 10 years, and it has become progressively more expensive to see a doctor. Increasingly, some people think twice before going to a GP, and some don't go when they should. And thirdly, GPs' incomes have been squeezed, and it is now difficult to persuade doctors to come to Jersey. And increasingly, it's not easy to get a doctor's appointment. The concerns expressed by this panel about the health insurance fund are not new. They were expressed in December 2020 during a debate on the government plan 2021 to 24, which led Deputy Martin, then Minister of Social Security, to say this: I understand the concerns. I do not share them because we will not be taking any more money out until we find that sustainable model. It will come back to the Assembly. It needs to come back to the Assembly. And it has to be done, as I said, before we can just carry on taking money out of the health insurance fund. The current Minister of Social Security seems to think that that undertaking has lapsed in some way. But whether that is right or not, it seems eminently sensible not to take more money out of the HIF until there is a plan for the sustainable funding of primary care. If the government had a clear idea of where it was going and what was going to happen to the funding of primary care when the HIF was reduced to zero, that would be one thing. But the government's officials told the panel that they had no idea at present what the plan would be. The plan may emerge sometime next year. I think that in the meantime, we ought to be increasing the value of the health insurance fund, not diminishing it. If we did increase it, we might be able to do something about dental care, currently in a lamentable state. According to the recent Jersey Lifestyle Survey, half of adults in Jersey say that the cost of a dentist's appointment stopped them from going. Children can wait years to get an appointment in the public system. This is deplorable in a wealthy community. Yet the 1967 health insurance law envisaged a similar insurance scheme for dental care more than 50 years ago, but nothing has been done. In my view, sir, there is actually not very much wrong with our health insurance scheme. It would be sustainable if the health insurance fund were not constantly diminished. It is different from the UK, but it is like schemes operated in many other countries. Of course, it can be improved. We should certainly increase the medical benefit. We should find a means of ensuring that everyone is able to afford to go to a GP when it is necessary to do so. Our health insurance scheme, which until a few years ago had worked well for more than 40 years, should not be put at risk by plundering the fund which underpins it. It is really disappointing that the government has brought forward this amendment. I retain a small hope that it might, on mature reflection, withdraw it, but if not, I hope that the Assembly will roundly reject it. Thank you, sir.
Thank you very much. Deputy Barbara Ward.
Thank you, sir. Firstly, I'd wish to thank the Health Minister and her team for providing the recent information and associated costs for a reduced number of systems they wish to be paid for by the HIF fund going forward. Having examined the information, I'm most concerned that the HIF funds in the main are for health and social services staffing, which in my view should be paid for under separate business plans to Treasury for an increase in the H&S budget to cover these new services and associated staff. We've heard from my colleagues the history as to why the HIF fund was set up to support GPs, pharmacists, dentists, and importantly, patients or the community in the primary care sector. However, what has been happening, I believe, is a departure from that principle. The Assembly needs to know that in previous years, the HIF funds were depleting and not sustainable due to increasing pharmacy costs. But with meaningful discussions with the doctors and pharmacists on the prescribing and dispensing of medications, which had a positive effect in reducing these costs. With the result, the HIF fund regained a more healthier position, providing longevity of funding provision for patients' benefits and free prescriptions. This was not a green light signal for health to take out money, which in turn is recommencing the depletion of funds. Examples of money being used from health and social services based on the recent information that has been provided us are as follows. 1. The out-of-hours community services, which at present is a trial. The GP Co-op out-of-hours service was set up in 2005 and provides out-of-hours on-call services to Ireland 365 days of the year. This service has and continues to work well at a cost of £350,000 a year paid by the Health Department, with on average 2.5 call/visits between the hours of 11 o'clock and 8 a.m. in the morning. Now, Health wish to have an additional service put in place with nurses employed to visit patients overnight, which from the stats that have been provided equates to 0.8 visits, but that is from 8 p.m. in the evening to 8 in the morning, at a cost of £973,000 a year. I feel this just doesn't add up and will worsen as the years progress to an eye-watering amount of £3.1 million by 2024, by introducing another layer of staffing at 3 times the yearly cost of the present system, which isn't broken, and I have to ask, what is going on? 2, oxygen and respiratory, which is a live project. Whilst I support introducing new services to help patients stay in their own homes and prevent admission, money for new services is wishing to have an increase of 3 whole-time equivalent staff members at £225,000. Again, this should be set out on a business proposal to Treasury and not taken out of the Health Insurance Fund. 3, immediate care management at a cost of £448,000. This is for a new manager by 2024, based on the information we have received. The Rapid Response Service, which is live. Whilst again, I fully support this type of service, I have to share with the Assembly the proposed cost of this is £2.66 million to pay for staffing, 3 consultants which are medical consultants and the associated staff costs. Again, a separate new business case should be tabled to the Treasury and not use the HIF fund to supplement more health and social services staffing. So I've demonstrated with just these few examples that the Health and Social Services is using the HIF money to pay for staffing and expansion of HCS services. The more you dig into the information, the more questions it raises. We've heard repeatedly from the general practitioners that the patient's benefit has not been increased for some 10 years, placing huge and serious pressure on GPs and primary care services. I am aware that some £9 million has been allocated to GP practices, but that's been on a sliding scale over the next 3 years, to assist in providing nurses and paramedics in GP surgeries. But there is no sustainability in this gesture. What will happen in 2 years' time? Please, no more money to be taken from the HIF fund. We must restore and protect the patient's benefit to today's rate with index linking going forward. If we don't use the HIF as it was intended, we won't have a sustainable primary care service, which looks after our community, providing 80% of our care. Sir, we have been elected to be open and transparent, take better care of our finances by looking at how state spends its money. I really do feel by using the HIF money to expand health was and is not the correct route. We need to know if any of the approximate, as I heard, £60 million from the HIF money already transferred has been spent on, for example. I'd like to know the number of interim managers paid up to £750 a day and housed in hotels. I'd like a full breakdown of how many health staff have been paid from the HIF fund to date. 3, how much of the HIF monies have been paid to the 30-40 staff working on the Jersey Care model to date, especially during the last 6 months, while the scheme has been paused? And 4, where's the evidence of what has been achieved with the £60 million? The public need to know how their money has been spent and on what. I believe the transferring of HIF money over the years to health has and is to the detriment of our GPs, pharmacists, dentists, and most importantly, our community, our patients. We are still waiting for the Sustainable Funding Report and the results of the Social Security Actuarial Report, which is expected, as we've been advised, the first or second quarter of 23. Until we have all the checks and balances accounted for, there needs to be a halt in raiding the HIF fund. Sadly, sir, I'm not confident in the way the HIF money has been spent by health time past. And what we have seen to date, based on the recent information, I have an increased lack of confidence, which I must lay with the Health Minister in the way the HIF fund money is being handled to date and for their plans going forward. I cannot support the amendment to the amendment, but therefore please ask that you support the Health and Social Security Scrutiny Panel's amendment. Thank you very much for listening. Thank you, sir.
Thank you very much, Deputy. Deputy Tadier.
Thanks, sir. So what we're seeing here, I think, is a thorough piece of work from scrutiny, and it's refreshing to see that, because up until now, most amendments have been either supported or opposed by government on the basis that you've got government on one side and you've got either backbenchers or a given party on another side, and the positions seem to be fixed. What we've got here is a piece of scrutiny work which has looked at what the government's seeking to do. It's got a diverse group on that scrutiny panel, which includes the leader of the Jersey Liberal Conservative Party, and it includes one of our members and an independent member and maybe another one. Sorry, I'm not sure if I know. I think it's Deputy Porre. So thank you. And Deputy Howe. So it's a good... sorry for not being fully aware of that. I know the first iteration and other members have been added. And that's good, and that's how scrutiny works, and it takes advantage of differing knowledge and experience and life experience, not just political experience, to look at evidence and come up with solutions. And it has to be said, when I hear an agreement, albeit that it is a scrutiny piece of work between Deputy Southern and Deputy Balash, the leader of the Jersey Liberal Conservative Party in the Assembly, and also when he makes such clear arguments in his opening speech, and as did Deputy Southern, I have to agree. And I see that we're in a situation, and I like the analogy about the sweet shop. I see a similar analogy about a man going down to his local watering hole to buy, and he decides that he wants to buy a round of drinks for everybody in the pub. And then the next day, he after coming back home, he realises that he doesn't have enough money to buy a meal for his family. And so he ends up raiding his child's piggy bank in order to buy the family a meal. And it's exactly that, is that the money in that piggy bank, it isn't his. There's a trust that's been broken by that act. Now, it's entirely right that if he wants to do something with that money, his own money, he can do that. And we come back to the fact that when it comes to hospital spending, that money comes through general taxation, and there is a legitimate use of social security money, the HIF funding, to fund things like GPs and dentists, which we're already struggling to do. And if anything, we need to increase that money, as has already been said, not decrease it. And for me, this comes back to basic principles, because it isn't a party political issue. It's about basic principles of fairness, trust and financial probity. And sir, I don't want to conflate issues unnecessarily, but it seems to me that yesterday we have a government that's prepared to give away money to people who don't necessarily need it unnecessarily. I'm referring, of course, to what happened with the empty rooms tax. And I know it's different amounts of money in terms of magnitude, but yesterday we have a government that's willing to give away £333,000. And quite coincidentally, on the same day I was telling somebody what we were debating. He says, I rent a room out. And he says, I says, oh, well, now you're going to get you won't be charged tax on that. And he says, why? I said, apparently you need the money. Apparently you're struggling. He says, I'm not struggling. He says, well, also we want to encourage people like you to rent more rooms out. He says, but I've only got the one room. It's not going to make any difference.
I make that by way of analogy, sir.
I make that by way of analogy. I'm sorry, if you could pause. What are you asking, Deputy Miller?
Sorry, it seems to me, sir, that when we've already agreed to try and limit speeches, Deputy Taddy is beginning to reopen a discussion we had yesterday rather than
Well,
point
I'm
at
sorry,
issue.
Deputy Miller, that's neither a point of order nor is it a point of clarification, and those are the only bases, unless you're going to talk about the fundamental rights of the Assembly, in which it's possible to interject during the course of a debate. The fact that you don't like it is really not a basis for interjection, I'm afraid. There's been no ruling relating to the length of speeches. I've asked members to exercise their own personal restraint and judgment, so there is no breach going on at the present time. Please do carry on, Deputy Taylor.
I apologise, sir.
Thanks, sir. And whilst muttering from people is difficult during a speech, certainly standing up and making spurious interruptions is also much more off-putting, I would suggest. But I was getting round to the point that my analogy is the fact that we have a government which is scrambling around on the one hand, raiding pots and piggy banks for money that they otherwise don't have a proper sustainable mechanism of funding for, whilst at the same time being able to throw money around, like the man at the pub, saying drinks all round, the drinks are on me, not the Milky Bars, the drinks are on me, and then later coming back to the Assembly and saying, look, we've got a serious problem about funding for health. What are we going to do about it? Let's raid this piggy bank. And it's even more bizarre, because we are debating the amendment, sir, and I recognise that there's necessarily some overlap between the main amendment and this amendment from government. They're saying, OK, we recognise that we shouldn't really be using this money because that's not the purpose of it, so we'll only just use a little bit of that money. Completely bizarre. That they should at least stick to their guns and say, no, this is a legitimate use of the HIF fund. or it's not. And that's what we boil down to, sir. This isn't a legitimate use of the HIF fund. If you've got a problem, and I believe that we may be starting to see the evidence of a government in crisis here, in financial crisis, because the writing's been on the wall for a long time that we need sustainable methods of funding our major tax spends in the island. Now, we might all have different views of socio-economics and what that means in the political arena, but we can't get away from the fact that to run an island with complex needs, increasingly complex needs, is costly, and that there's a minimum amount that needs to be spent, especially in healthcare, not on the building of a hospital, but on the facilities that then go in that hospital. And to make sure that whoever it is in 10, 15 or 40 years' time, that they're getting the care that they need to. And it can't be done just by grabbing and penny pinching here and there from pots where there is no legitimacy in that process, sir. So I do ask, first of all, the Health Minister to back down on this, to pull this amendment, actually, and to support what the scrutiny panel and its cross-bench representatives on that panel have recommended.
Very much. Colin Tabberson-Lawrence.
Thank you, sir. I smiled to myself when Deputy Southern stood up and began his words by saying promises, 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 because he is absolutely right. And to me, this is a Groundhog Day debate, because I can't remember the number of times that we've debated what Deputy Southern referred to as a raid on the HIF Health Insurance Fund, and Deputy Balash used maybe an even stronger word. He said, we have plundered the HIF. And I can't do any more than agree with both of them in relation to the way we have treated this fund. And it's clear from the 1967 law that this Assembly has made decisions about how we spend that money in ways which are not actually, in my view, entirely in keeping with the intentions behind the fund when it was set up. And although I'm speaking to the amendment, I know I'm veering so into the amendment itself, but I think they're inextricably linked. And in the report of the scrutiny panel, they tell us that in July 2022, so the then newly elected Minister for Health and Social Services made the decision to pause the Jersey Care Model programme of work to allow time for herself, and as a new minister, but not only as a new minister, but as a new member of the State's Assembly, notwithstanding her health background, she was a newly elected member of the State's Assembly. And I think it was quite right that they paused the Jersey Care Model programme to enable her as minister, and indeed they say the Council of Ministers, to review activity of the Jersey Care Model at that time, including progress and spend against the original JCM objectives. But then it's very interesting in the report that the new Health Minister confirmed two reasons for the pause. And the one that struck me in relation to this debate of the amendment to the amendment was that she confirmed that one of the reasons, it was predominantly driven by concerns raised by the public. Not only are concerns being raised by Assembly members, but by the public about the way in which the HIF was funding service developments. So what the Minister has said today has not in any way alleviated my concerns. And she has not convinced me by any means that I should, or members, any of us, should be supporting this amendment to the amendment. The list of raids on the Health Insurance Fund are listed on page 4 of the panel's report. I know that I have resisted raiding or plundering that fund over the years. The one item that I can't remember though, is I may well have gone with the raids in 2020 to respond to COVID-19. I hope I didn't, but I can't remember whether I did or not. I know I haven't supported it over the years. So I am not supporting the Council of Ministers amendment to the amendment by the scrutiny panel. And I urge all members to support the amendment by the panel. We rely on scrutiny very much at times during the government plan debates, because there is so much in it that the pressure is really on them to act as the critical friend to the Council of Ministers and act on behalf of us all. So I'm not supporting the amendment to the amendment, but I will be supporting the panel's amendment itself. Thank you, sir.
Very much, Connie Tubbs. Any other member wish to speak on the amendment to the amendment? Deputy Hull.
Yeah.
If someone's not in the Assembly, could you indicate in the chat, please, whether you wish to, and then we'll call on you. Deputy Howell.
Thank you, sir. The scrutiny panel thanks the Council of Ministers for acknowledging that money should not be taken out of the HIF for the hospital digital programme. And we are now asking the Assembly to agree not to use any more money from the HIF to fund the Jersey Care model. We all applauded the Minister for pausing the Jersey Care model in July. There was a sigh of relief. A new States Assembly acting positively, listening to the views of islanders during the election and determined to do the right thing, realising that the Jersey Care model could never work because we simply do not have enough staff, and the savings promised were pie in the sky. Common sense would prevail. How disappointing then that as a result of her review, the Minister now says that the care model will carry on as before. But she wishes to rebrand it, call it something else. My question is this: how can the Minister's review, released a couple of weeks ago, be considered independent and objective when the very officers employed to devise and implement the Jersey Care model undertook that review? Would not the Assembly members consider this as a case of marking your own homework? Unsurprisingly, the recommendation of these officers is that all but one of the projects should continue. Another interesting point. Whilst there is mention in the review of the Minister meeting with the Independent Oversight Board, there's no statement of their findings or recommendations in the review itself, which seems very odd, as they are the ones tasked with such oversight. So before approving any further transfer of monies from the HIF, I would suggest that members of the Assembly ask themselves why the Oversight Board had recommended a pause to the care model. Surely the board must have considered something to be wrong. What was it that they were unhappy with? Have they been consulted since the Minister's Care Model Review? Have they agreed to restarting the projects and embarking on new ones? Meanwhile, how do we know then that the continuation of projects and services which form part of the Jersey Care model are providing the best and most efficient care and support for islanders, when there has been no independent verification of such, no public consultation or patient feedback? This is confirmed by the Minister in her foreword to the review, when she states that there needs to be a more formal evaluation at the earliest opportunity to assure ministers and the public that delivery is in line with the anticipated outcomes, both financial and non-financial. So why are all the projects to continue and new ones to start when we don't have the answers? What was the review for? Why did the minister bother with the review at all? The HCS scrutiny panel has not been given the opportunity to scrutinise or give a formal evaluation. We're not quite sure how many millions of pounds have already been taken from the HIF. At least 40. But what have these achieved? Where is the accountability? Why is the HIF paying the salaries of so very many managers and administrative staff? We need to assess whether or not projects to be supported really do benefit the community and primary care. And if so, are they as good value for money? Indeed, we need to question the health department's exorbitant spending on strategic planning, analytics, and commissioning. Many of us stood on a platform of fiscal prudence, and we promised to spend Islanders' money carefully. For a government that also stands for openness, transparency, and accountability, it is time to drill down and seriously question HCS spending, spending that has to be justified. So Deputy Ward, Barbara, and I have split up the list for what the HIF has been earmarked to pay for in 2023 and 2024 between us. We do not think this should be happening. It is not how the HIF should be spent. It is not what the HIF is for. But the first one on my list is telecare community alarms. And we've spoken about this, a lifesaver for many islanders. But under the care model, they are now double the price. Islanders used to pay £10.56 a month. Now they have to pay £21. We need to question the costs of £566,000 per annum. The second one on my list is HCS 24. This is a phone call answering service, a bit like the UK NHS's 111. It was introduced as a top-down initiative. This service is employing 17.4 staff, including occupational therapists, clinical supervisors, patient-facing civil service. So why are they spending £18,000 renting a room in Lister House? How is this providing best value for money when mental health professionals are no longer involved? And an islander used to be able to phone up a department, talk to someone, or leave a message. We already have a hub at Family Nursing, and the ambulance switchboard used to be responsible for all call handling for the community alarm system and all emergency calls, including those between 11 p.m. and 8 o'clock in the morning. Figures reveal there are 65 calls a day, perhaps 5 an hour. My funny arithmetic, I reckon that's £57.80p per phone call. Is that good value, do you think? Why not just employ 1 or 2 receptionists? But better still, if HCS 24 were to be stopped, we could save almost £1 million a year. And the physiotherapists, the occupational therapists, the social workers would then be free to go and actually see patients and look after them. Number 3, not so much this time, only 216,000 for digital projects. Health demographics, e-referrals, the Jersey Care record, all very commendable, but I believe the digital component should come out of the digital component of the HCS budget. Number 4, discharge service. £388,000 if patients are discharged early from hospital rather than remaining in hospital. Then, in the words of the Director General of HCS when the Jersey Care model was first introduced, money should follow the patient. And I think HCS should be foot the staffing bill. The HIF is not there for salaries. And my final one was only 11,000 for a care pathway development. I think this could be done without funding. It's simply a matter of various clinicians getting together to discuss. Again, there is no way it should be funded from the HIF. So I seriously question what the money, at least 40 million, possibly 60 million, from our HIF has been used for. I suggest it may not be providing proper benefit to patient care and support in comparison to money being spent. I urge you, please do the right thing now. Please stop any more squandering of our vital health insurance fund. Please vote against the Council of Ministers amendment and instead support the scrutiny panel's amendment. Let us keep the HIF, our HIF, and use it for GP consultations, prescriptions and actual primary patient care for all islanders. Thank you, sir.
Deputy Tom Binet.
Sir, this is quite a difficult one for me. The use and misuse of the health insurance fund has long been an important issue for me, and I'm afraid it remains so. As a consequence, I've already expressed my intentions to my colleagues on the Council of Ministers. My thoughts on the matter are very similar to those expressed by Deputy Balash, so with much regret, I'm afraid I won't be able to support this particular amendment. Thank you, sir.
Deputy Andrews.
Thank you, sir. Now, I find it rather peculiar. We've had a number of speakers, and actually we've not seen many members of the Council of Ministers who've actually supported the Health Minister. Now, I think that is actually quite intriguing. Of course, we've just seen Deputy Binet, who has actually stood and also is in opposition to the amendment. But I think there's actually a couple of items that I've really picked up on here. Now, there was a review that was conducted, and it was in relation to the Primary Care Board, who basically advised that there were concerns over the result of the primary care outcomes in terms of the actual benefits from the investment in digital. And I think that's quite important to actually allude to, because here we would be seeking investment to actually improve things. Now, if there is question marks that remain in terms of the actual proof of outcome being successful, then we have to be asking more questions. And I think that's really important. And for me, I'm a backbencher and also I'm a scrutineer. And of course, this is not my remit in terms of the panel that I'm on. However, I have taken a great level of interest. And I think with Deputy Southern, his opening speech, it was most welcoming because he mentioned about the value of the fund decreasing from 92 million to 48 million by 2025. But also, as well, I did a bit of research, and the fund from a 2017 review was actually going to be forecast to be exhausted by 2035. So where is contingency of planning? There isn't any. And actually, I think there is some reluctance for certain ministers to be standing up in this debate, because actually they do realise that there is a sufficient level of support in opposition to the amendment that the Council of Ministers have brought forward. Because why are they not standing up? Why are they not speaking? I think they realise that actually they need to go away and they need to do more research and they have to come back with something that is going to be much improved. Because, yes, it is mentioned within the law that the Treasurer of estates and also an investment manager may be able to actually source funds from the Health Insurance Fund. But I don't think this is the time or the place to do it. Absolutely not. Because we just need to look at the disconcerting devaluation of the fund that is currently forecast. And I don't think that is good enough. And there has to be a contingency that is going to be forthcoming. But I'm afraid I cannot support the amendment that the Council of Ministers have brought forward. And actually I will be supporting the scrutiny panel, sir. Thank you.
Much indeed, Deputy. Chief Minister.
Thank you, sir. And I thought I ought to rise following the Deputy's challenge. It is, of course, a difficult matter. But as it's clear from the amendment, this has been as a result of an attempt from the Council of Ministers to seek some middle ground on this one, because it's quite right, and I agree with Deputy Howell, that the use and misuse, I think she said, of the HIF has been a matter of concern. It's concerned me too. And therefore, we have approached this in a way that enables us to, firstly, move forward, secondly, restrain, and that means that we have focused this amendment by only allowing items that are in relation to primary care and primary care alone to be included within it, because, as Deputy Andrews alluded, some research is needed, and other speakers have mentioned that the actuarial report is coming forward very soon. That will give us the evidence that we need to continue to turn around the work of the previous Assembly. But what is more important, of course, is that firstly, the HIF was created in 1967. Our healthcare, our demographic structure has changed drastically since then, and we therefore need an opportunity to revise it, to consider how best we meet the primary healthcare needs, the dental care needs of our islanders. And we've shown that desire in a previous debate on the Common Strategic Policy in relation to our approach to primary care for children. And so I hope members can understand that we come at this with the very, very best of intentions, but we also have to be pragmatic and find a way forward. And that pragmatism also relates to the General Reserve. And we do have to ask the Assembly to help us protect it. We're all very aware of inflation and the impact that it's having upon our community and upon our spending power. And most importantly, we have to think about our staff across the states of Jersey, all of those people who need to be looked after, and in particular our healthcare workers and also those in education. We have to ensure that we can achieve a settlement with them all and look at our pay, that we can have a stable workforce to deliver healthcare, not just for next year, but for the year after as well. And members will be particularly aware that it is an important thing to do in this respect, to deliver a stable workforce, because at the moment we are hemorrhaging money, sir, on bank staff and temporary staff. Millions of pounds are being spent, and we have to turn that around. So, members, I ask you to help us by supporting this amendment, which does go halfway. We understand what the panel is saying. We absolutely do. But there is more work to be done. Let's not forget, we're only a matter of months into this term of office, and we have a tanker to turn around. But turn it around we will, and those activities are all in place. The Minister has already given her considerations on the Jersey Care model, and we are delivering the other aspects of turnaround in terms of the wider health and community services brief, which is very much needed, and we do not shy away from that.
Very much, Chief Minister. Does any other member wish to speak on the amendment to the amendment? Deputy Oates.
Thank you, sir. I rise as a former Treasury Minister and as a member of the Council of Ministers in order to, I think, set a few facts straight, if I may, in respect of this amendment. I have been downstairs looking at the previous allocations of the health insurance fund, and in the remarks by Deputy Balash, he portrayed, as much as many members do, a concern about the use of the HIF and its original purposes. I was a member that brought amendments to the Health Insurance Fund back in 2012 in order to allow for primary health care. It may be of assistance to members to be reminded that in 2013, the balance of the fund was some, I think, 100 million from recollection, and the HIF medical benefits through to 13 to 18 have been in the region of 18 million, 18.8, 18.2, 8.1 million, 8.8, 8.8, 8.2, 8.1, and 7.8 and 7.7 in 2018. Those are the HIF benefits that are for GPs. In addition to that, there is, of course, pharmaceutical benefit, which is attendant to primary healthcare. Those are 18.1 million in 2013 through to 19.4 million in 2018. In addition, there is gluten-free, 300,000 for people with issues with those problems, primary care, and in 17 and 18, some additional 100,000 was given for the hospital pharmacy for their dispensing of products, and also other GP services of 250,000 of 300,000. So I think, to characterise, if I may, the Health Insurance Fund as just simply a GP fund. And I understand that. Many people will think that it is GPs, but of course it's all of our primary healthcare professionals, and that is other primary healthcare professionals that should be. Many members, I see Deputy Howell and Deputy Ward, no doubt with their huge experience in these matters, will know that doctors, for example, you can have a nurse should be able to be availing themselves of where a GP, as members have said, there is concern about the amount of GPs in Jersey, but you can have a prescribing nurse that is currently, as I understand it, not able to avail themselves of the benefit in order to get that co-payment to see a benefit. They're not allowed, or they are now. That's a recent evolution. So there have been a number of positive evolutions. So when we originally changed the HIF to allow primary health care services for contributors that were available, being provided for at the General Hospital, cautious allocations were made for the HIF. And I can go back to see that the HIF arrangement, certainly in my time, and both the current Treasury Minister, when he was Social Security Minister, was extremely particular in relation to the amounts that could be taken from the Health Insurance Fund in line with its original objectives. I regret, and I agree with Deputy Balash, absolutely, that the last government passed some further statutory changes approved by this Assembly, which made it almost be regarded, quite understandably, almost like a self-service buffet for dealing with matters in the General Hospital. And I know that there has been great care taken by the Council of Ministers, and the Health Ministers had quite a hard time at the Council of Ministers to ensure that the allocations which are being requested fall within the spirit and the moral compass of the original Health Insurance Fund, which Deputy Balash and others have so eloquently explained. And so it is quite right to say that recent decisions from the last Assembly were questionable, maybe, in terms of the original purpose. Maybe lawful, sir, passed by a law of the states, but questionable in their use of funds, which may well not have been entirely in hindsight. But we can't change the past, sir. We can make changes now. And what the government is proposing, as I understand it, having been part of the scrutiny and that internal challenge that happens at the Council of Ministers, is challenge, and rightful challenge. And so the amendment, as proposed by taking a very clear understanding of the concern my concern, other members' concern of the use of the appropriate HIF has been made. And just to put into context, it is, of course, those pharmaceutical benefits that are, at the moment, the big use of the fund. I was a member of the Council of Ministers that had to agree when GST was introduced to give pre-prescriptions. We've seen prescribing rates go up. Maybe that's the reason why pharmaceutical benefit has gone up so much when we have free prescriptions. These are all issues which have been authorised and approved by the States Assembly, which, as the Chief Minister quite rightly says, have been needing to be attended to by the new Council of Ministers. And it's very difficult. It is extremely difficult to deal with some of these issues. And we have to move forward with action, not words. We have to deal with amounts that are fulfilling the criteria of the moral and legal intent for the much valued health insurance fund, which members of our community have absolutely rightful expectations, having contributed it over many years, to basically better fund primary care. The original intention of when the law was brought in, I think in 67 or 74, was primary care as we saw it then. But primary care is, of course, extended in its remit so very much as medical advances have been made. And we can do so much more with primary care. We must work with our doctors. We must put the end to the debates about them being nationalised, etc. We must give certainty to our valued GPs, and we must, of course, find a way of a co-payment system that will work. So these all underpin the Council of Ministers amendment. They are cautiously, properly considered, in line with what was absolutely required in terms of the original purpose of the fund, which is absolutely correct. It is right and proper that the original purposes of the fund are in scope of the 1967 law and those changes, which I certainly agreed with back in the 2010 amendments, the draft miscellaneous provisions that was changed, the further changes that were made in 2012, and those allocations there. I would stand and say that those were proper. These amendments, as proposed by the Council of Ministers, are proper because they fall within the scope of the Primary Healthcare Provision Fund and its improvement. And we need to improve our primary healthcare. The Chief Minister is quite correct. No doubt the Treasury Minister will also address us on the challenge that's have been made in respect of these particular funds. I am one of these members that also stood on the election and said that we need to bring back control to health expenditure. We need to sort out our health service. It is the health service that is provided in our GPs, surgeries, in our primary care surgeries that must be sorted out. The less people we have going into hospital, having received excellent care by our GPs, with an appropriate co-payment, which has not been done. But this government is absolutely clear with our Social Security and our Health Minister working in tandem to ensure that we have the right use of these valuable funds, which rightly is not a tax, it's a contribution, and it should be regarded as such. But the amounts that the Council of Ministers has been making are within, as we are advised, within the remit of the original purposes of the fund. And I just would draw members' attention to the sheer scale of the allocations for contributory benefits that are made from both the GP co-payment and the pharmaceutical benefit, which is much, much bigger, hugely bigger than the co-payment, unless a member wishes to correct me on that. So, sir, the Council of Ministers is faced with an inherited position that's uncomfortable. The consequences of the full amendment, this amendment not being passed, will have a serious difficulty for the consolidated fund, and that is a matter which has been uppermost in members' minds. And so I would respectfully suggest that members are respectful and that they take the undertakings given by ministers in respect to the use of the fund. These will be carefully overseen, carefully scrutinised, and they are in line with what is the not only the legal abilities. This is not the self-service buffet. This is the carefully allocation of funds for primary healthcare and primary healthcare improvement, which is necessary to help our GPs, help our general practitioners in other primary care, and also the pharmaceutical benefit. And so, sir, I, as a sceptical member of the Council of Ministers, members say Council Ministers would not stand and speak. I speak, and I speak in line with what should be done with the Health Insurance Fund. I know that's 11 minutes, sir, but I hope members did want ministers to speak. I'm a sceptic, but I'm also a scrutineer on the Council of Ministers, and I will be supporting the Council of Ministers' agenda, but keeping a very watching brief over the future of this and needing to reform the fund overall, which is something that the then Social Security Minister and I, when I became Treasury Minister, set out on a piece of paper about what we should do. It just then didn't happen for various different reasons, but we must do it, and I know the Social Security Minister will do it with the Treasury Minister, and I ask members for a respectful support of the Council of Ministers' agenda. Thank you, sir.
Very much. Does any other member wish to speak on the amendment to the amendment? No other member wishes to speak? Deputy Miller.
Thank you, sir. I support strongly the amendment put forward by the Council of Ministers and the Minister for Health and Social Services. The Minister for Health and I had a detailed meeting, private hearing with the scrutiny panel and discussed our proposals in terms of this amendment. I do believe it's the right way forward, and I was disappointed that the scrutiny panel did not feel able to support the Council of Ministers' amendment, because what I heard very clearly from the Minister of Health was that the work that has been undertaken as part of the Jersey Care model, and whatever we call it, the underlying projects and programmes, complemented directly or provided primary and community care. And they were doing that. And if we withdraw this funding, those services will be at risk. I can't endorse a situation where government takes a step backward and withdraws services that are currently available to members of the public under the banner of primary care, simply for the reason that they are part of what was called the Jersey Care model. Those services are important, they provide valuable resource and support to members of our community, and we must preserve them. At the same time, I can't agree to a situation where an impossible strain is put on the Minister for treasury resources by adding to the pressure in the General Reserve. Do any of us want to be in a position next year where we're balancing withdrawal of essential health services or strikes because we cannot fund pay rises, for example, for some of our essential workers? It's an impossible situation. The economy in 2023 is still going to be a difficult place. We know this morning that inflation rates in the UK has reduced slightly, but it is still very high and it is not going to reduce next year. We must be able to fund inflation increases, parental leave for public services employees, pay rises, and without then adding to the burden of health services that are quite appropriately paid for from the HIF funding. As Deputy Joseph and the Chief Minister have said, we have heard the concerns of ministers and members of the Assembly about use of the funding. But I would emphasise that despite the language you've heard this morning about plundering and raiding and thieving from piggy banks, no money was taken from the HIF without the approval of this Assembly. And some of the people that have commented on that were part of the Assembly that made those decisions. And you may have voted against, but you were part of the Assembly that made those decisions. Laws that the previous Assemblies made law changes to permit those transfers to be made. The transfers are only made after very careful scrutiny and after the funds have been expended. Funds have not simply been handed over to health as a piggy bank that they can dip into. We've been very clear on how the money has been spent and how the money has been applied. As far as the 2024 figures in the amendment to the amendment are concerned, those have been included there as estimates only based on the current work plan. We will review all of this with the Health Minister next year before those funds are spent. If I could just return a little to some of the other things that have been said about the purpose of the HIF. As we've heard more than once already, the HIF, the Health Insurance Fund law, was set up in 1967. That was 55 years ago. Our society and our population has changed dramatically. In 1967, the life expectancy of a person in the UK was just under 72. In 2022, it was just over 81. That 9 years of a difference makes an enormous difference to the provision of healthcare. We have all, I hope, seen the graphs that show that the projected increase in population over the next 30 years of the number of members of our community that will be both over 85 and over 95. Those graphs horrify me. I'm also horrified, I have to say, by the proposition by Deputy Howell that health does not need a strategy or analytics. How on earth are we going to prepare for a large population of people who are over 85 and over 95 with their primary, secondary, tertiary healthcare needs if we don't have a strategy and we don't have analytics? It is vital that we start thinking about those things now, because otherwise, I know in 30 years' time, I'll be one of the people that is over 85 and heading towards 95, and I want to be sure that primary care is going to be there for me if I make it that long. We all have an interest in ensuring that we have a sustainable healthcare system for the future, and that is exactly what my review of benefits in the next year and the Health Minister's review of the funding model is intended to achieve. We need to understand that. I've lost count of the number of times in this Assembly we've heard ministers say, we don't have the data. That's shocking. We cannot be in a position in 5, 10, 20 years' time where we do not have the data about our own population and their healthcare needs. In 1967, we didn't have lots of elderly people needing care in their homes or in care homes. We didn't have bed blocking because people were able to come out and be cared for by their families. The world has changed. We have new treatments. Treatments that were acceptable in 1967 are no longer acceptable. You would be negligent if you prescribed or conducted some of those treatments, whether that's in skin care, mental health care. People were treated in mental health in 1967 in a way that would appall most of us now. We have got to move with the times. Deputy Balash, as part of his speech, said that the original purpose, and he's not the first person to tell me this, the original purpose of the Health Insurance Fund was to meet 50% of the costs. I'd be interested in his evidence of that proposition, because my officers tell me that there is no report, no proposition, no policy paper setting that out in writing. It was nothing more perhaps than an aspiration. It would also be a money pit. We cannot say we will also always meet 50% of the costs because we don't control those costs. GPs control the cost of a visit, and we could agree to pay 50% today to find that the cost goes up next month and the month after and the month after, and that is not to suggest that doctors would behave in any way that is cynical as regards the rebate. But we have to look to how we provide healthcare. As I've said several times in the Assembly, and the proposition that monies have been taken out of the HIF to the prejudice of primary care is simply incorrect. As I've discussed several times now in my 6 months in the Assembly, we have invested from the HIF in monies to improve doctors' IT systems. We have agreed contracts under which the government pays for flu jabs and cervical screening, which used to be paid for directly by members of the public. I accept that is not additional revenue to doctors, but it's for the patient benefit. And more people now have flu jabs, and more women. We have some of the best rates for cervical screening anywhere in the UK. That is because of the investment made by government from the HIF. We've entered into contracts for the Health Access Scheme, and I know that there are voices who want to improve and increase that scheme, but we have a scheme at the moment which works well and which allows people on low incomes to see doctors for reduced fees and for children to see a GP for no cost at all. We have enabled doctors to charge fees for remote consultations, which they were not able to do historically. Those were all free. Because of the pandemic, they can charge for Zoom calls and by telephone calls. We have, as I discussed briefly yesterday, we've invested £9 million to support the inclusion of allied health professionals. That means that we will be paying the wage bills, I think for last year and this year, for nurses, paramedics and other healthcare staff, and as well as paying their salaries, we are enabling the GPs to charge a fee for a patient to see a nurse. £20 to see a nurse may be the best use of time. It's cost effective for the patient, and it's the best use of doctors' time. We know that there are pressures on recruitment at GPs in Jersey, but we are not alone. There is a global shortage of doctors. The UK, on the news this week, we've heard about the shortage of GPs in the UK. That's one of the reasons why we may be struggling, because there's a tension with GPs and a shortage of GPs in the UK. When I went to the British and Irish Council meeting in September, I met a politician from Ireland, and he said that on his drive to Dublin Airport, he saw a huge billboard from the state of Victoria in Australia advertising for doctors and nurses from Ireland to apply for jobs in Australia. Australia advertising in Ireland for doctors. How soon before they're doing it in the UK? There is a tension, and it is important that we do make sure that we are getting the best use of all our health professionals. We're also working closely with pharmacists to extend their services, to allow pharmacists to do more prescribing and to extend their services to make better use of, to give better primary care. Lastly, and I know that not everybody agrees with me, I can see Deputy Southern from the back of my head rolling his eyes. We do need to think about technology. There are lots of technologies available to all of us. My GP told me a few years ago, it is about 3 or 4 years ago, there are lots of health gadgets out there. You can buy for less than £20 a sensor that will tell you what your pulse rate's doing and what your blood saturation level is. They sold out during the pandemic because we all became obsessed with it. You can buy very effective heart rate monitors, blood pressure monitors. My GP said that he will get patients, mostly men, who will come in with pages of information that they have downloaded from their health devices to show the doctor what their heart and their blood pressure has been doing in the last month to help the doctor with his diagnosis. My mum, who's 86, spent a month recently taking her blood pressure at home on her own and then recording it to take to the doctor so that the doctor could then assess what she needed in the way of medication. These are all valuable things that we need to do and support. We need to support all these steps. The amendment from the Council of Ministers is intended to maintain and support primary care. Primary care is not just supported by GPs, it's supported by a whole range of professionals, and I would encourage the Assembly to support the amendment to the amendment. Thank you.
Very much, Deputy. Does any other member wish to speak on the amendment to the amendment? Deputy Alex Curtis.
Thank you, sir. And I don't intend to be long in speaking, but I thought we'd respond to the challenge or the request from Deputy Andrews. So thank you. Although I may not be a minister, I do have part of a portfolio. And so I was thinking about the word from the Chief Minister about steering tankers. I am no expert in health, but I do have experience with a department with sometimes equal scrutiny or challenge within the government. And I really think it's interesting to hear the simplicity in the way we talk about some of these problems. Some problems are simple, some aren't. And I really just rose to stand to say that I do stand here supporting the Health Minister in a pragmatic decision. I have complete faith that when simple, obvious and common sense approaches face her, she will take those options. But I can guarantee you, and when you will be challenging my portfolio at times with simple proposals, nuance prevails, as we heard from Deputy Doublé yesterday. And I think we should be taking the time now to be thinking about pragmatism, thinking about the challenges and supporting our Health Minister, which is what I will be doing on the amendment to the amendment.
Any other member wish to speak on the amendment to the amendment? No other member wishes to speak? Deputy Gorst.
Thank you, sir. And I understand that the difficulty that some members are having with the spend of the Health Insurance Fund. It was referred to by the mover of the initial amendment, the date and the first spend out of the Health Insurance Fund for primary care, which wasn't delivered through GP practices or through pharmacists. And I was so sceptical, Sarah, at that time that I put in place a reporting mechanism from the health department. I'm not sure whether they were dragged kicking and screaming. And that was overseen firstly by the Treasury Department. It was then passed to the Social Security Department, and I used the internal auditors to review and thread back the money that had been requested before any payment was made to the Health Department in order to deliver that service. Because I do accept and I fundamentally believe that the Health Insurance Fund belongs to contributors, and it is theirs. There is a governing law. I like to think that the role of the Social Security Minister is really to act as trustee of that fund, to make sure that it is allocated appropriately with the oversight of this Assembly. And I know that this Social Security Minister will take her fiduciary responsibilities in regard to that law very, very seriously indeed. But we also, sir, must be absolutely clear with one another today that the costs of primary care are increasing, and also the costs of healthcare generally are increasing, and the Social Security Minister just reminded us about the global shortage with GPs. I am personally a great supporter of the current system that we have in Jersey with general practice, with the co-payment system. I have elderly relatives right now who I think are getting a first-class service from their GPs, and I've got nothing but praise for them. But this fund is and does rightly belong to contributors and is to be used for the provision of primary care in our community. And I choose my words carefully, primary care in our community. And the incoming Health Minister has taken the steps that she has. She's reviewed what's called the Jersey Care Model. I, like many members here, are concerned and have been concerned that a care in the community model taken from somewhere else is not necessarily the right approach for Jersey, but that is a work in progress. And the review that the Health Minister undertook quite clearly showed where the spirit of the Health Insurance Fund is met, i.e. The provision of primary care services, and she's explained the benefit of that. Coming back, sir, to the comments of Deputy Barbara Ward and Deputy Howell, and they said much, sir, with which I agree. They were questioning the processes that health have got in place around the spending of funds. And I know that the Health Minister will not mind me saying that I share their concerns. And whilst the Health Minister with the support of the Chief Minister, is rightly delivering a turnaround plan and all that that means. For my part, I believe that there needs to be a financial turnaround plan for the health services as well, and we've discussed this at the Council of Ministers, and that means massively strengthening the financial controls and spends and procurement within the health service, and I will be supporting her in doing that. Now, so I'm also acknowledge that I think that the last time that the co-payment to GPs was increased was potentially so when I was Social Security Minister, and that now is a long time ago. But that was part of a package of change. We had an increase in co-payment. We had the necessary regulation of GPs to enable them to continue to practice and be licensed to practice. And I am not averse, in principle, of an increase to that co-payment now, because I accept some of the arguments that GPs are making. But if we are going to, and I do support it, as I've said, and I've said this around the Council of Ministers table, increase those co-payments, we need to think about the value that contributors are getting from that co-payment. There are stresses within GP practices, and there's a lot of work that the Social Security Minister and Health Minister want to do, or would want to do and do want to do alongside any increase in co-payments. So the Health Minister has found herself in the position that she has, being the new Minister. And in light of conversations with the scrutiny panel, and we've heard those arguments very passionately played out today in this debate, she, together with the Social Security Minister, sought to be pragmatic and really divide up those things where, yes, they were lawful, in line with the amendment made during the term of the last government, but were they coming back to that in the spirit of being primary care provided in the community? And that's why the Health Minister came up with the amendment. And I support the amendment because I think it is a very pragmatic approach, whilst the further work that ministers want to, that members want to be done, is done. Again, I say to members, I propose taking out the money for 2024 and coming back and finding in the government plan during the course of next year a way that members could have much more confidence going forward. But I understood the arguments for why the Health Minister didn't want to do that and wanted to make this amendment. So what this amendment does, of course, is recognise that in the spirit division of primary care, but it does then put the best part of £8 million, it reduces the general reserve from doing that. And the general reserve is part of the government plan to provide in-year flexibility for unforeseen circumstances. And of all the times that we need the maximum amount of flexibility around unforeseen circumstances in the general reserve, surely 2023 is one of those years. But again, in the spirit of being pragmatic, ministers have accepted that what it will mean for the in-year stresses within their budget and those unforeseen circumstances, yes, and the pay negotiations, they were prepared to act pragmatically and say to members, we hear the spirit of the argument, we are going to need to operate under more constrained budgets because there'll be less flexibility in 2023, but that is something that they are absolutely prepared to do. And it's for those reasons that I support this amendment. But we should be under no doubt that whilst we need sustainable funding mechanism for primary care, we also need a sustainable funding mechanism for healthcare right across the board. We hear this morning in the United Kingdom that there's more spend on the NHS than there was pre-COVID, and yet waiting lists are longer and the number of operations being undertaken are down. So the pressure on health budgets in Jersey, but also elsewhere, are only increasing. And we must be mindful of that when we are having this debate. I also remind members, sir, that back in, I think it was 2017, there was a proposal to increase funding to healthcare, but that was rejected by this Assembly on a split vote. So it's not easy to come forward with sustainable mechanisms, be that primary or more general health funding. I think this is a pragmatic approach. It does minimise flexibility, but not completely. It does live within the spirit of primary care delivered in the community and therefore is appropriate. Thank you, sir.
Thank you very much, Deputy. Deputy Renouf.
Sir, I think I come at this without too much baggage, and I've tried to think my way through the underlying issues. I recognise that the HIF is a hugely emotional subject, but I've tried to understand what I think is the fundamental issue at stake. From where I'm looking at it, the HIF is part of the total budget of what is spent on health. Transfers from the HIF have been sanctioned by the Assembly, so they are legal. The question is, are they right? We all agree we have a total funding provision for health, of which the HIF is part. The effect of the amendment from the scrutiny panel is to increase total health funding. This is because we will continue with existing HIF funding, the HIF will grow, and we will add to health spending from the General Reserve to fund the important work that the Health Minister has outlined. I'm absolutely clear that the work that the Health Minister has outlined needs to be done. We need to redesign our health services, including our primary care services, and work is underway to do this. If the scrutiny amendment is accepted, the General Reserve will be used to fund this work, and this will have the effect of adding to total funding of the health budget. This might be fine, but the issue is, where does the money come from? If we take the emotion out of this, the real issue here is, do we raid the General Reserve to increase health spending? So my view is that's problematic, and I think that the amendment that we've suggested is a more pragmatic way forward. As several people have pointed out, the General Reserve is going to be needed to respond to events. And as the Chief Minister and the Treasury Minister have said, there's one particular set of circumstances about which we need to be particularly mindful, and that is the question of future pay rises. But there are, of course, all sorts of unexpected events, other unexpected events, which we may need to fall back on the General Reserve for. So, sir, I'm not ashamed, as Deputy Balash says I should be, to support this government amendment. What we have suggested is a sensible allocation from the General Reserve so that we can keep some flexibility. It is a compromise, but a responsible one. It recognises concerns about HIF transfers and limits spending to only those things that fit comfortably within the primary care definition. But it also insists that we should have just as much regard for the integrity of the General Reserve as we do the HIF. Members need to know that if they back the scrutiny amendment and reject our amendment, that there will be less money for contingencies such as pay rises. That's a choice members are free to make, but be clear that that is the choice in front of us. For myself, I believe the Council of Ministers has struck a good balance. Please support our amendment.
Deputy Sutherland.
Thank you, sir. And this has been quite a wide-ranging debate, but I just want to return to some basics because people have been all over the place with some of their statements. And the first statement I wish to repeat to members is Deputy Martin's statement some time ago: we will not take any money from the HIF until we've had a review. Social Security Minister has gone further in calling for actuaries to review current practice. An actuarial review of the HIF is prioritised for 2022, now 2023 or beyond, including specific analysis of the use of the HIF for the purposes of the JCM and its related digital strategies. Consideration of the impact of all the withdrawals on the fund since 2020. The future of the HIF, should withdrawals take place as envisaged in P130 2020, and overall, as part of the wider review of sustainable healthcare, sustainable funding for healthcare, that's the essential bit, there will be a specific consideration undertaking to repaying the HIF from the Consolidated Fund if no sustainable healthcare funding is operational by 2025. So you've got the backstop is waiting there if things go wrong. And for those who have suggested that we tiptoe around the reserves, may I remind them, it's called the Reserve Fund. It's meant to be there as a reserve. Yes, it will require some adjustments as we go along as to how we balance that fund, but nonetheless, we don't risk anything by saying, and we can fund this from the General Reserve. We don't risk anything. In terms of what constitutes primary care, can I also go back to the Primary Care Board and repeat again what I've said before? We understand, said the Primary Care Board, that a sum in excess of £11 million has already been allocated to health to replace secondary care IT. So that's where the money's going. Secondary care IT. Not primary care, not GP fees, not prescriptions, not primary care, but secondary care. Whilst this capital investment is overdue as a result of decommissioning of previous software with limited capability, it does not represent investment in primary care IT. They couldn't repeat it more forcefully. Where the money's going is not to primary care. It's going to secondary care IT. That's where it's disappearing. That's the reality. And to pretend otherwise, I think, is to fool ourselves. The overall analysis of what we're talking about here is key to this, and it comes back to those first three words: promises, promises, promises. Promises of a thoroughgoing independent review as to how we are going to fund primary care services, health services from now on. I'm not denying, and nobody is denying, that's a major piece of work. It will take some time. Sometime in the next year, from 2023, we should see some results from that. At which point we can say, the way forward is X, Y, or Z. That's what's laid out on the information in front of us. And that's the pause that my panel are saying, this stage, without that plan, we shouldn't be spending more of the HIF, because it will get depleted. And we will end up in worse trouble than we might otherwise be. Can I just briefly mention the Constable of St. Lawrence? It's always a joy to hear her, but I'm always on tenterhooks as to which way she's going to go on a vote. And she particularly, I believe, leads some votes. But it's nice to see this time around that, as far as I'm concerned, she was on the side of the angels, supporting our amendments and not the halfway stage, the halfway house that the ministers have come up with. And it was very interesting to see that these proposals from the Council of Ministers are described as the middle way. They're not the middle way because they're not about primary care. And it was interesting to hear Deputy Gorst talk about the spirit of the law rather than the practicality of the law, the hard black and white of the law. It's never heard before. I've never heard Deputy Gorst go for the spirit of the law rather than the absolute fact of the law. So that was very enlightening as well. And in particular, I must focus on Deputy Ozef, who spent quite a while going through some facts that were not relevant. Yes, £18 million is spent on prescriptions and pharmaceuticals. Yes, £8 million, much less than that, is spent on GPs. Question mark. And are our GPs suffering? Yes, they are. Can we get enough GPs? Are we going to see some more GPs surgeries close in the future? Yes, we are. So they're struggling. So something needs to be done. Nothing else. If you don't concentrate on anything else, that says things need to be done. We need to get on with doing the right thing and finding a way forward. Otherwise, we'll go down. And yes, lots of people are staying healthily alive for a lot longer. Yes, that's part of the issue. That's part of the problems we have to solve. We won't necessarily solve it, but with loading up the HIF. It may require another structure in order to do it properly. Let's get on, let's find that other structure, let's find the information, let's find the evidence, give us a chance. That's what we're saying. It was interesting also to hear Deputy Ozef talk about some questionable decisions, which he managed several sentences later to come back to some proper decisions. It's been done properly, although it started questionable. And basically said, and I'm scrutiny on the Council of Ministers, and the process is safe in my hands. He's very good at that, is Deputy Ozef. And then we've had this argument that we can't touch anything because things might go wrong. So we've got to put in an element for the cost of living. This year, next year, the year after that. We don't know. We have to do something about the cost of living, we know that. But that's an argument to add, not today, but in the future. There is a balance to be made, I think. There is a middle way, and the middle way, I believe, is represented by our proposition, our amendment, rather than the ministers. The ministers have not grasped what they need to do. At which point I'll stop. Thank you.
Thank you very much, Deputy. The Constable St John.
Thank you, sir. So I believe the amendment is well intended, and whilst I accept that there have been changes to the 1967 law, I do believe that this Council of Ministers isn't comfortable with those recent changes to the law, hence the removal of any digital spend. One of my predecessors from St John often spoke in defence of the Health Insurance Fund over the years, and I'd like to add my voice of concern on how the fund has been used, particularly in recent history. So I use the exact words that Deputy Bolos used when the Council of Ministers discussed this subject, that it appeared like robbing Peter to pay Paul, although the Deputy is far more eloquent than I. We've heard from members of the panel of how much work there is still to do, as well as plenty of opportunities to make savings within HCS. This work has to be done, but it will take time. The challenge that we have is to keep moving forward whilst we look at ways to improve things. Health is not something that we can put on hold whilst we look at how we can do things better. As Deputy Gore stated, there is a plan to turn around HCS, far more important in my view than any building, and his intention to look at the whole financing of health is also in my view essential and long overdue. As Deputy Southern stated, this is a big piece of work. So we often talk about collaboration and compromise. We have an opportunity here to demonstrate both. On this basis, I will support the amendment, and like Deputy Joseph, I will continue to challenge the progress, and I expect to see change ahead of 2024. Thank you, sir.
Thank you very much, Connie Tarb. Deputy Scott.
Thank you, sir. Well, how many times have we heard the argument government shouldn't be put on hold? Government must keep on chugging in the way that it always does. I have experience, even within the GP practice that I visit, the enormous amount of stress, the way they just keep trying to continue despite the money that actually gets deprived from them. One of my doctors has actually left owing to the actual pressure because of the stress. Has anybody been thinking about that particular recruitment crisis that's going on at primary care level? Perhaps not, because perhaps the health department is always kind of focusing on the hospital, on the secondary care. Perhaps that's really where their focus is. But when I hear Deputy Renner speak, I love it. He's got the most amazing voice. He ought to talk in nature documentaries and that sort of thing. And I love hearing his tones. But one thing he said to me, and I think he perhaps was trying to deconstruct the argument, but it was like, oh, you're going to be raiding the consolidated fund. Hang on. For the money to get into the consolidated fund, it came from where? Oh, yeah, the health insurance fund, the one that's meant to be serving primary care. I really think, and I think it is time to draw a line in the sand. We've just had enough of this train that's chugging along. Health management does need to actually start sorting itself out. And if we create some sort of crisis there where they really have to grasp the nettle, good. I won't be supporting this amendment.
Thank you very much. Deputy, if you could forbear from striking the table with your book, because that doesn't work well over the system for recording purposes. But
So can I ask for clarification? Did the member mean she won't be supporting the scrutiny panel's amendment?
Deputy said she would. I thought said she would not be supporting this amendment to the amendment. That's what I thought you said, Deputy. Is that correct? Yes. Very well. Does any other member wish to speak on the amendment to the amendment?
I missed it.
Deputy Kovac.
Thank you, sir. I won't be long. I just want to make some clarification, and that is that health staff, it's public services. Pay rises and salaries for public services as much as are needed and very welcome should be from tax as usual, not from HIF, just because they work in health. This will create a wrong precedent and wrong use of the fund. The fund should be used to help the people have more, better, and easier access to primary care. And actually, there are next two amendments which are going to be having discussion on the same note. And I'm very curious how this assembly, not just the Council of Ministers, will discuss on that note. Thank you.
Deputy Rose Binet.
Sir, as I agree with the views expressed by the members of the scrutiny panel, I regrettably will be voting against the government and with scrutiny. Thank you.
Thank you very much. Does any other member wish to speak on Deputy Gardner?
Thank you, sir. I will be short. We are inherited this position, and I personally really uncomfortable with. And I was one of the people who raised at the Council of Ministers what we are doing, because I don't think, as Deputy Joseph said, it's not self-service buffet. And I completely agree with it. I did have a conversation with Deputy Barbara Ward, I did have a conversation with Deputy Hall, and I completely with them. Now, as Deputy Southenthay told us, let's go back to basics. And I would like to ask Assembly, I know that we're long debate, to hear for 3 numbers. Basically, we have 12,450,000 that we are talking about. Scrutiny proposing to take all of them from the General Reserve, government proposing, an additional proposition was from HIF. We looked back and actually said, no, it's not right. We cannot continue to rate HIF. What we need to do is to establish, and we go on line by line, what is connected to the primary care. And from 12,450,000, we have 4.2 million connected to the primary care. This is the reason that will be taken from the HIF. Remains 7.4 million out of 12 million plus will be taken from the general reserve. The separation should continue, it should be clear, and it's important to tell we are not taking for any IT development from the HIF. The IT development would go from the general reserve as it should go. So it's really important, and it's a choice, and this is the reason that we need to take money from the pockets of the money which they deserve, and primary care, including community and GPs, coming from the HIF. And this is the reason of the separation and of the amendment. I will be supporting the Health Minister because she did a brilliant job to explaining all Council of Ministers, all small projects, and this is how the decision was made. Thank you, sir.
Deputy Morale.
Thank you. And I'm very pleased to follow Deputy Gardner, because I wanted to clarify exactly that point, that Deputy Southern was claiming that secondary care IT will be funded through the HIF. This amendment to the amendment ensures that that does not happen. This amendment to the amendment ensures very carefully that only primary care services are funded from the HIF in this case. That is entirely proper according to the rules of the HIF, both the letter and the spirit of the law. And there is a reality here that the Health Minister has inherited a position. There is an issue with regard to overall health funding that this island needs to grapple with. And when we see common sense compromise such as this being brought forward, I believe it is the right way forward, because we cannot at the same time restrict ourselves and the contingencies that we need to make sure the island has going forward to enable spending where it's unexpected cannot be compromised in this way. So bringing forward this amendment to the amendment, which ensures only primary care services are funded from the HIF, that they decrease, and that it is clear the Health Minister understands that the State Assembly no longer wants the HIF to be used for anything except the primary care services, is absolutely the right way forward in my mind. We need to support the Health Minister, who has inherited an incredibly difficult portfolio. The previous government had, yes, undertaken with the State Assembly's approval, had undertaken to use the HIF for other purposes, which I agree, as Deputy Gardner agrees, as other council members, ministers agree, weren't appropriate. And we are trying to turn that around. We are trying to change that. But it cannot all be done in one step. What we are saying here is we need to take 2 steps to make that change, and to do so in a responsible manner that ensures we have the money set aside in the general reserve to enable pay rises, to enable contingencies where they arise, and they can be from anywhere. And so I do ask the States Assembly, please do support this amendment to the amendment. The Health Minister is doing an incredibly difficult job, but she's doing it incredibly well. And she's taking a very practical and pragmatic approach. This is the first step to making sure the HIF is not used for secondary care purposes and other purposes other than primary care. Thank you.
Deputy Mezek.
Thank you, sir. I rise. I need to make a very brief contribution into this debate because I seem to have heard at least 2 ministers dangle the carrots in front of us about pay rises for health staff. And of course, that sounds very enticing. And so I'm simply standing to challenge ministers to therefore confirm if they're raising that in this debate, is that because they currently have plans to make some form of generous pay offer to our health staff. If that's not the case, then it is not a carrot to dangle in front of us in this debate and is inappropriate to do so. So I would simply like them to confirm that, and if they're not willing to confirm that, then I hope members will consider that to be an argument that falls away and vote against this amendment and in favour of the original amendment from the scrutiny panel.
Does any other member wish to speak? If no other member wishes to speak, then I close the debate and I call upon Deputy Wilson to reply.
Thank you, Ma'am. Can I just say thank you very much for what I feel has been a very, very rich debate, and thank you for all of the considerations. There are a number of words that I've written down in terms of the things that people have talked about, but at the top of the list is legacy. And actually, we're carrying a legacy of decisions that have been taken previously, for which none of us really understand now what that decision-making process was about. But it arrived at a point that was to fund the transformation and the modernisation of healthcare. It was a decision taken to bring healthcare in line with a modern, less institutionalised offer to patients and carers. We all know that the scale of the challenge was enormous. The endeavour points in the right direction. 24/7 services for patients. Treatments provided in the comfort of one's own home. A single point of access for information. Better information exchange between clinicians and practitioners so that patients don't have to repeat their history over and over and over again, depending on which clinician or which practitioner they go to. Helping patients with long-term conditions to manage their own condition at home with new technologies instead of ending up in a hospital bed unnecessarily. Bringing improvements to public health. These are just a few of the initiatives that have been delivered with the support of the investment from the HIF. Funding a large-scale transformation programme needed a clearly defined budget and a clear delivery plan. The previous Assembly recognised the need to change the healthcare system or to face the prospect of ever-increasing healthcare costs. And if you have a look in the paper that was written in terms of the original business case, it was touching £700 million per annum. The previous Assembly recognised the need to do something, and as a result, they agreed that the Health Insurance Fund would be the source of funding to deliver this change. I want to applaud members of the scrutiny panel, as Deputy Tadier says, for really drilling down and doing the scrutiny work well. So thank you, colleagues, for that. But the claim that the HIF has been used illegally or not in keeping with the spirit of the law is simply quite wrong. When we talk about the way in which the system of insurance works, actually in the legislation itself, it says that the HIF is a system of insurance in relation to medical, dental, ophthalmic and other health services, including pharmaceuticals, and, in other words, reflects primary and community care. It goes on further to say that the Health Insurance Fund is there to establish systems of governance and minimum standards for persons providing a service. In other words, policies, standards, information management,
sharing, records, record keeping and good records management. It also talks about the fund being able to deliver services in line with standards of performance, to actually contract for services. In other words, we know this to be commissioning of services. So all of the things that you've seen in the Jersey Care model, and I make no apologies for not being there at the start of it, but all of the things that are in the Jersey Care model relate to some of those dimensions as written in the law. They are all focused on meeting these requirements. This amendment is fundamentally an attempt to find a balanced solution as to how we fund the remaining areas of work that are currently under the guise of the Jersey Care model. It serves not only to manage the clinical risk, and in all of the debate, I heard very little talk about patients and patients' experience. It serves to manage not only the clinical risk of what effectively is switching off care and services if they're not funded, but also attempts to reduce the burden on the General Reserve and the public finances, which are already stretched. And that is a duty and responsibility that is seriously considered in this amendment. As a Council of Ministers, we recognised that we could do something to ameliorate the concerns that have been raised and expressed by members about how the HIF is used. Through our amendment, we seek to compromise so that we can continue the work that's already underway to transform our care system and to avoid any detriment to patients. Funding healthcare is a serious business. It really is a complex, messy business. And the mechanism for funding healthcare has to be consistent and not open to fluctuation that is associated with a change in political leadership. This fluctuation leads to uncertainty and ultimately poor clinical outcomes. The healthcare industry is at its core a complex, evolving and dynamic system. It is a human system that needs to operate 24/7, 7 days a week, 52 weeks a year. And so to manage this, levels of variation, it needs a reliable funding model, which is why I will be bringing forward proposals during 2023 for a more sustainable model of health funding along with a new primary care strategy. And I know Deputy Southern may well be cynical, but we already have the work stream underway. It's not the case that the HIF has been used illegally, as has been previously asserted. Rather, it has provided a funding stream to progress the development of a modern health system which has primary care at its very heart. We must also not limit the government's ability to meet unforeseen expenditure, and so we need to protect the General Reserve to manage inflationary pressures and also support for contingencies. We propose that activities funded by the HIF are those directly associated with primary and community care services, and that the general reserves are activities related to what we call system enablers. For example, the technology. This amendment seeks to ensure consistency and continuity, to continue to legally utilise the HIF for the purposes it was intended, with additional safeguards that require the permission of the State Assembly. I would just like to finish on one point, which is to say the issue of oversight I've heard loud and clear today. And what I can assure the Assembly is that we will strengthen the financial oversight of this work programme and anything else associated with health developments, health redesign going forward. And any proposal that is brought forward will be subject to a case-by-case review, and it will go through the appropriate level of scrutiny, and that is the commitment I give to you today. I ask members to accept this amendment, and I call for the impel. Thank you.
Well, the impel has been called for. Members are invited to return to their seats. And I ask the greffier to open the voting. All members have had an opportunity to cast their votes. I ask the greffier to close the voting. And I can announce that the amendment to the amendment has been lost. There were 16 votes in favour, 1 abstention and 29 votes contrary.
Can we have the 16 and the 1, please? Well, thank you.
Those members voting for the Connétable St Helier and St John, Deputies Dublé, Ayer, Gardner, Gorst, Moore, Osoph, War, Renouf, Jean, Miller, Alex Curtis, Wilson, Morell and Miles, and the member who abstained, the Connétable of St Mary.
Very well. We now return to the Fourth Amendment. Does any other member wish to speak? No member wishes. Oh, Deputy Osoph.
So, Ma'am, this now puts in even worse situation, I think, on the situation. The Council Minister's amendment, which of course members have spoken strongly about, was attempting to limit, as we've heard, the allocation from the HIF. This now puts the original unamended amount and is a greater amount of money from the HIF. I haven't got the numbers in front of me, but they are even greater. So if the compromise and the undertakings that were given by the Assembly weren't sufficient, it now falls that the full amount of the transfer from the general, from the amounts will be in the region of, if I'm not mistaken, I seek some guidance, 11.1 million from the HIF fund. So this now puts a greater, and there was no shroud waving. This was a sensible amendment with no other linked issues in relation to staff payments, etc. This was just good and prudent housekeeping in respect of appropriate use of the HIF for primary healthcare services now lost. What we now face is a situation where there will be, if this amendment to if the amendment is passed, there will be no withdrawals from the HIF. And as I said in my earlier remarks, this would now mean that all monies for the necessary primary healthcare services, which was originally put forward by the Council of Ministers, then scrutinised, then goes back to the full amount. And maybe the Treasury Minister will wish to address the Assembly on the implications of that. We are now betwixt and between a situation which is now very serious because monies will be remained in the health insurance fund, unable to deal with the transformation. This has got nothing to do with the care model, I think, because that's almost something that is now being reviewed by the health minister. Sorry, sir. Sorry, Mark. And we now have a very serious situation in respect of the inability to use any money from HIF for primary health improvements. I'm speaking partly to because the debate was going to be closed. I don't want to speak for very long because I know the Treasury Minister will address us and the Chief Minister on the implications, which I simply don't know how they're going to be dealt with from a Treasury point of view, that this amount of money is now no longer going to be available, and this has now got consequences to the ability of the budget to be able to be balanced in its final conclusions. But I look to the Treasury Minister to explain the implications of this. This is an incredibly a difficult decision because I think that the amendment says zero. So if the amendment is lost, then I think that the Council of Ministers can then it's a maximum amount of money that could be put to the HIF. It doesn't necessarily need to be made. The Treasury Minister can advise about whether or not anything, if it's a reduced amount of money, even lower than that which the Council of Ministers has lost, clearly taking states members' understanding, then maybe the only way that the Council of Ministers can do this is to ask members to reject the amendment and therefore limit even further, if that's possible, the allocations from the HIF from the maximum amount that's made. But I look to the Treasury Minister to, after having taken the implications of the last decision and to try and work out what to do. There may well need to be a pause because the implications to the balancing of the budget, as a previous Treasury Minister, will be very serious. This is a very large amount of money, and I don't know how the Treasury Minister proposes to deal with it. But on those remarks, I will take guidance from the Treasury Minister and the Chief Minister of how we should be voting, because simply putting this amendment through, understanding completely members' concern about the use of the HIF and rejecting the arguments that was made in the original proposer, that this was a completely sort of self-service buffet arrangements, which I would have agreed with in the last Assembly, but I tried to limit them if they can be limited even more. But accepting this amendment in its entirety, I don't know whether the Treasury Minister can, as I say, give some guidance about limits that could be done in order to limit yet further from the lost amendment and bringing that down even further. But zero, which is what the implication says, has got serious implications for the delivery and transformation of primary healthcare services. Primary healthcare services in line with the 1967 law, in spirit of the 2012 amendment, which was still in that, disregarding effectively the ability for the states to make primary, wider than primary healthcare services. But I'll leave my remarks at that, and maybe the Treasury Minister can address us with the Chief Minister on the full implications of this. Because as I stand at the moment, I have no alternative, but I think to ask that this amendment be rejected, but on the understanding that the withdrawal would be even less than that which the Council of Ministers has lost the amendment for doing it. Maybe it just went too far, but the Treasury Minister may address us with the Chief Minister.
Deputy Gorst.
Thank you, Mum. Yes, I rise to follow Deputy Joseph because he does indeed articulate the consequences of the amendment that the scrutiny panel have put forward. And of course, it's the democratic system at work, Mum. And we are all respectful of that. What that democratic system at work does, of course, lead to is consequences. And if the Assembly now supports the scrutiny panel, that means that the general reserve of 29 million will be reduced by 12 million. And Deputy Mezek asked ministers to stand up and talk about the pay award negotiation. I'm not going to do that, but a simple calculation looking at all of the allocations across the government plan can see that any flexibility or contingency is now by accepting the scrutiny panel's amendment, is reduced by that £12 million because the Assembly will be asking ministers to take that money out of the general reserve. So it's not the consolidated fund, it's not pay rises coming from the health insurance fund. I know these things are quite complicated. This is the general reserve. The general reserve is used for, and I remind members, we've got two Amy and Dells. What they are, in effect, are around annually managed expenditure and departmental expenditure limits, and they allow the minister, in large part for Social Security, to deal with fluctuations around the benefits budget in year. We can't say, as we continue in a cost of living crisis and economic difficulties, what the minister is going to need to and have to spend as a matter of law in regard to benefits. There are other legal obligations upon departments. We have to put money aside for those, dependent on the economic circumstances. Now, there is some other flexibility in the general reserve. We put aside £5 million to support the health minister with waiting lists. I cannot be the only one it cannot be just in St Mary, St One and St Peter's, where when I knocked on doors, members of the public were telling me about the length of time they were having to wait for consultations, for scans and for interventions. That I was seeking to give an extra £5 million to deal with that. We know post-COVID that those waiting lists have reached an unacceptable level, but the reality of supporting the scrutiny panel now is that allocation will have to be removed. We then have COVID-19 reserve, which we'd already pared down from which the department had asked for. None of us can predict the future in that regard. The previous government made a decision to improve for state employees parental leave payments. I think that the Assembly supported that. That's put pressure on departmental budgets that wasn't there. So in general reserves, there's £2.5 million for that. There's the actions arising out of the 100-day action plan, just shy of £3 million there. Excess inflation. We know that we can't be certain about what inflation will do throughout the term of 2023, although we know right now, that inflation is running at just over 10%, but this budget was put together when inflation was running at just under 8%. So members can see that we are going to, if we're not very careful, get into great difficulty during 2023, having now decided that the pragmatic approach suggested by ministers is not one that the Assembly wishes to support. And for those reasons, even though I stand by the comments that I made in regard to the amendment to the amendment, and I stand by the actions that I support in that amendment to the amendment as well. I cannot, for all the reasons I've just explained, now unfortunately support the scrutiny panel, and yet I know entirely what they were and are trying to do. And it is therefore with a heavy heart, Mum, that I ask members to reject the scrutiny panel's amendment, even though it arises from some very good work, and the points that they make are points to have much to recommend them. But for those reasons, it will make the delivery of the plan in 2023 so much more difficult, and members shouldn't be surprised if during the course of 2023, things that have been said during the course of these amendments today aren't repeated. Not sure whether that will be contrary to standing orders, Mark, but there will be. Yes, but there will be. There will be consequences. What, of course, this also does is means that it makes it even more difficult for ministers to come forward with further cost of living interventions into the future. But we remain committed to our political priorities, and that remains a political priority. It just makes everything more difficult if we now go ahead and support the amendment of the scrutiny panel. No doubt others, as they've made their statements during the course of the amendments debate, will make the opposing view and will tell government to scuttle off down the road to Broad Street and sort it out. That's the nature of a legislative assembly, of a legislative assembly. But we should be absolutely clear that there will be consequences, as there is of every political decision. Thank you, Ma'am.
Deputy Ward.
Thank you, Ma'am. I refer to the presentation I made earlier, and I did talk about the interim managers that are paid up to £750 a day. And we still haven't had any information on that, and in a way, to help fund what the HCS wants to do, they need to really drill down and look at the level of management that is within health and social services, especially the interim managers that are brought in, housed at the Grand Hotel or one of the other prestigious hotels in St Helier. And they're on there for a good 6 to 12 months. If you look at the cost of that, that would be maybe to help some way in helping some of the new services that we want to bring in, which I would support. I mean, I was a community nurse, worked in health, always want to move forward with technology and better care for patients at the end of the day. But you can't be going down, bringing in very highly expensive staff into a service, in some ways at the detriment to our frontline staff and our patients' future care. So I think I would ask that if, in working with the Treasury, that health sit down and have a really good look at the cost of these staff. Do we still need the 30, 40 people staff for the Jersey or the old Jersey care model? You know, let's have a really good look, and it may not be the pressure on our reserve funds as we think it could be. Thank you very much. Thank you, Ma'am.
Deputy Balash.
Thank you, ma'am. I'm not going to prolong this debate because it seems to me that the Assembly has made its position clear. The Assembly has voted not to take money out of the Health Insurance Fund. It has voted not to rob Peter to pay Paul. I don't think, Madam, that ministers should whinge about the democratic process. Other arrangements will have to be made. Deputy Gorst was quite right. As the late Duke of Edinburgh might have said, get on with it.
Thank you, Deputy. Deputy Faltham.
Thank you, Ma'am. I won't take long. I think the message from members during this debate has been loud and clear around the use of the HIF fund. The Council of Ministers has made much of the fact that it has a balanced budget within the government plan, and I think what we're questioning here is quite how the Council of Ministers has chosen to balance that budget. Now, within our scrutiny comments, I think one of the things that again comes across loud and clear is that members that aren't part of the Council of Ministers do not have sufficient information about how the very vast heads of expenditure by departments are going to be spent. Now, I would like to remind ministers that ministers are in full control of those heads of expenditure, and they can move money around within those heads of expenditure, and they are quite at liberty to rebalance their budgets when I think this amendment gets passed, to allay all of the issues that have been brought forward by Deputy Ozuf and the Treasury Minister. But I will be supporting this because I do agree with the scrutiny panel that HIF funds should be used appropriately and as the Assembly intended, even if the Minister for Social Security's officers cannot find the paperwork to support that. But I think maybe the officers should listen to the messages coming out of this Assembly today, and if the paperwork doesn't exist, maybe it should be produced. Thank you.
D. Miller. Okay. The Constable of St Lawrence.
Thank you, ma'am. I heard in her summing up the Health Minister refer to the term, I think, illegal use of HIF, and I don't recall that term having been used by anyone when they spoke, although I may have missed it. The terms used which rang a bell with me were that the HIF had been raided and plundered, notwithstanding, ma'am, that those decisions had been made by previous assemblies. But not everyone agreed because many of us voted against it. I had written down, before Deputy Gorst said it, when he spoke a moment ago, that the use of funds from the HIF, the Health Insurance Fund, is clearly a political decision. Deputy Gorst has just told us that. And the political decision that I think is being made today is that those members in the chamber today, or virtually, do not want the HIF to be raided again and to be plundered. We've heard from Deputies Howe and Barbara Ward, who have drilled down through their scrutiny role to the way that Health spends its money. Deputy Howe gave us a list of concerns, that questions remain over how they spend their money. Are they spending it effectively? Are they spending it as well as they could and indeed should be? And in my view, questions still remain about how they manage their funds. Agreed, it's a vast estate, it covers such a vast area, but someone, and it is the Health Minister, has responsibility ultimately for the expenditure by health. A new minister, yes, as I said when I spoke previously, but she has got to get to grips with how her department spends its money. So my views, ma'am, is that I agree with what Deputy Gorst said earlier. Not only is this a political decision, but I think the message today should be to COM, go back to Broad Street and sort it out. And I will be supporting the amendment.
Deputy Scott.
Sir, what a great time for leadership among the Council of Ministers. And we really are looking forward to seeing them beginning to change a culture that voters want to have changed. This culture of just carrying on as we did before, and sure, we'll get round to sorting out the management. And let's hope they don't encourage the culture of let's save money by getting rid of the workers. not actually addressing what really is happening in terms of management within government. That's what we want to see. You've managed to produce a 100-day plan, probably in a couple of weeks. Not sure how long it took. Sorry. The Chief Minister has managed to produce a 100-day plan and managed to do that in a very short time with a great team. So there's going to be hopefully another plan produced with our Minister of Resources, which really does look at the way in which government can deliver and actually turn round to these, the previous, to managers, to director generals, to actually just say, this is what the Assembly wants. I'd like to just remind you, Ma'am, and I think you were around at the time, that the Chief Minister, in her previous role as chairman of the Corporate Services Scrutiny Panel, did actually hear from the Controller and Auditor General part of the reason why there has been an element of dysfunction in government. And the reason given was government just not quite knowing what good is. This is a great opportunity for our Council of Ministers to now show this community what they really can do. Thank you, ma'am.
Deputy Tadia.
Thanks, sir. It's good to be on the same argument, same side of the argument as my St Brillard colleague, Deputy Scott, and long may that continue. I hope that we find much more common ground in the Assembly. And what I've seen by this is we had a remarkable situation where as soon as the vote didn't go the government's way, we have the External Relations Minister, Deputy Ozef, standing up, basically saying, oh, we don't know what to do now, floundering, as if the government hadn't ever considered that they might lose an amendment in the Assembly and so not have a fallback position, which I think, as Deputy Balash says, this is democracy. And we don't need to rehash that debate. I think it's quite clear why members didn't support the raiding of the HIF fund, as it's been said. But it's remarkable because when we as a party certainly consider amendments, whether they're our own or whether they're other members, we consider what happens, what we do if we're successful, and we consider what the fallback position is if we don't succeed, and can we stomach what we're left with in terms of the amendment. And this doesn't seem to have happened on behalf of the government. So we seem to have, again, ministers in disarray with no plan B. And all this talk about illegality and of the use of the fund, it boils down to policy at the end of the day. It's about what the policy has been, and the HIF has been set up for a particular purpose. And this Assembly has quite clearly said to ministers, we don't want you to use the HIF fund to fund these projects. That doesn't mean that ministers all of a sudden are impotent. The government effectively is saying we have various work streams in the health sector that we need to pay for, and the Assembly has simply said we don't want you to use the HIF fund to pay for those work streams. That's all it is. It's not the end of the world. And as Deputy Feltham said, ministers actually still have lots of power. We don't get to decide how the individual lines of expenditure are paid for, and I know that there'll be scrutineers both in terms of capital and small s, ma'am, that will be looking at that in the same way that I will look at areas of expenditure when it comes to culture and arts, for example, amongst other areas, knowing full well that I don't have the ability to direct where they're going, but we can look at the heads of expenditure. So those are simply the observations that I make, sir. We're not in a no man's, no woman's land, sir. Simply, the message has gone out strongly, and the policy must be respected, I think, not just now, but for the duration of this Assembly, and it will be for future generations of Assemblies to decide whether they want to change the policy of what the HIF is for. But that remains a challenge both for this Assembly to find adequate ways to pay for both primary healthcare and other aspects of the health portfolio.
Does any other member wish to speak? Deputy Moore.
Thank you, Ma'am. So the previous vote wasn't just a bloody nose, it was a full-blown, massive nosebleed. There have been several speeches suggesting that perhaps we should just go back to Broad Street and work something out, which of course we will have to do if this amendment is supported. But I would just like to remind members of the words of Deputy Gorst, who, as he said, was not shroud waving, but simply delivering to members the consequences of this decision. Let me just go back slightly. We're only debating during this week those elements of the government plan where we hadn't been able to reach a consensus. And the purpose of the amendments to the amendments was to try and offer a better way, another path, a way of forming some agreement, which is what we did in relation to Amendment 4. And it was described very clearly to members that those elements that were put forward in our amendment to Amendment 4 were elements that related specifically and clearly to primary care, and therefore they sat within the rules of the Health Insurance Fund law. And we have already acknowledged that we understand the frustrations and the distinct concerns of members because we ourselves hold them too. I understand Deputy Barbara Ward's points about management, and that is something that we are already grasping. If I can repeat what we have already said before, there is a turnaround plan in place. We are doing our very best in terms of the acute care provision, dealing with those management issues that we are aware of. And we acknowledge that, and we are finding a way forward. But in relation to this issue, I really urge members to reject this amendment from the scrutiny panel. As the Treasury Minister said, the scrutiny panel has done its work, it's done its work well, but it now is removing £12.5 million from the General Reserve, which ties our hands as an assembly and ties our hands as a government in terms of the flexibility we have to deliver for the public, to deliver on the mandate and the promises that we have all made to meet the cost of living, to help people who find themselves stretched financially against inflation, to help people who are experiencing waiting lists, who have to wait in pain for operations. And also to support parents so that we can improve the consequences, the experiences of early years, and deliver parental leave, which comes at a cost. So members who are tempted to support this amendment now must also be prepared to stand up and deal with the consequences, because they are not easy to resolve. And the members who support the amendment will have to live with them. And that's all I can say. So, now.
Does any other member wish to speak? Deputy Kovac.
Thank you, ma'am. Just a very brief suggestion, because the Chief Minister said that how clearly Deputy Gorst as well mentioned, there's going to be a gap of 12.5 million in the General Reserve. Maybe as a suggestion would be to consider better when backbenchers or other members are also bringing propositions to bring funds of the potential of that proposition, and not like to consider it in the same way like it would be brought from a scrutiny panel or from the Council of Ministers. They, for example, lost a chance of bringing up to 50 million yesterday, and so many other propositions which would have bring funds and could have solved this problem. So it's just a suggestion. Thank you.
Does any other member wish to speak? Deputy Southern. Sorry, Deputy, you'll have an opportunity to speak at the end. Sorry, I'll call you in a minute. If no other member indicates that they wish to speak, then I close the debate and I call upon Deputy Southern to reply.
All of 15 seconds difference. Okay,
This is the democratic process. This assembly has made its mind up. This assembly is being encouraged to somehow do something other than what it's decided. It will be a hard decision to make, but how many times have we heard ministers say, this is a hard decision to make? Yes, it is hard. Oh, it's going to be difficult, but the budget is balanced. It's balanced at a different point to what the ministers expected it to do. Nonetheless, I urge members to stick with their opinion and to vote for this amendment.
Do you call for the APAL? The APAL is being called for. Members are invited to return to their seats. And I ask the greffier to open the voting. All members have had an opportunity to cast their votes. I'll ask the greffier to close the voting. And I can announce that the proposition has been carried. There were 31 votes pour, no abstentions, and 13 votes contre.
Can we have the conch, please, ma'am?
Greffier.
Those members voting contre, Deputies Doublé, Ayer, Gardner, Gorst, Moore, War, Renouf, Jeune, Miller, Alex Curtis, Wilson, Miles, and Morell.
With an eye on the clock, mindful that the Assembly agreed that they would take a shorter lunch hour, I'm not sure whether we want to, with 7 minutes to one, start on an...
Can I propose the adjournment, Madam?
The adjournment has been proposed. Can members show they're in favour? The Assembly adjourns until 2 o'clock.